Jamie.
I did it last time.
Uh, You did? Okay, Linda. Mm, You ready? Okay. Good morning, everyone.
Morning.
Morning.
Good
Good
morning.
morning, colleagues. Good morning, everyone that's joining us for today's special meeting. At this time, I would like to call our meeting to order, and we'll stand as our Vice Chairman, Linda Cuthbert, leads us in the Pledge of Allegiance. Ms. Cuthbert?
I pledge allegiance to the
The
flag
flag
of
of
the
the United
United
States
States
of
of
States
America,
of
America
America and
and
to
to the
the
republic
republic
which
for
is
for
which
which it
it
stands,
stands,
one
one
nation
nation,
under God, with
indivisible,
indivisible
with
liberty and
liberty and justice
justice
for all.
for all. Thank you, Madam Chair.
Thank you, Ms. Cuthbert. Good morning, everyone. Thank you for joining us on our Tuesday, August 11th special school board meeting. At this time, I would like to introduce my guest at the dais. I have Mr. Carl Persis representing District 1, 4, I'm sorry. Mr. Ruben Colon representing District 5. Mr. Ted Doran, our school board attorney. Ms. Erin Lieben, our agency clerk. Ms. Jamie Haynes representing District 1. My vice chairman, we just heard from, Ms. Linda Cuthbert, representing District 3. Our interim superintendent, Dr. Carmen Bagabin, and I'm Ida Wright, your chairman, representing District 2. Items for approval on this agenda is item 3.01. Public participation. Time will be provided for public comments on the action item 3.01 before a board vote is called on the item. For public comments during the virtual meeting, please call area code 386-734-7190, extension 20236. Again, that number is area code 386-734-7190, extension 20236. At this time, um, because it's a special meeting, we will not have input from my colleagues like we normally do. We will go right into our agenda. We'll move to item 2.01, district update. Dr. Bagabin.
Good morning, Madam Chair. Good morning, school board members. Madam Chair, at our last meeting, the July 28th, 2020 regular school board meeting, the board requested that we have a special session today for the purpose of providing to the board an update on a few subjects. So there are 4 items for which you will receive an update for today. And it will be in this order. First, we have Ms. Patricia Boswell with us here today. Ms. Boswell is the director for the Florida Department of Health for Volusia County, and she will provide for us today a status update on the numbers related to our COVID-19 cases here in Volusia County and answer any questions that the board may have. Second, we have with us also Mrs. Rose Rowland. Mrs. Rose Rowland is our Assistant Superintendent for Student Services, and she will provide to the board today an update on the mass committee meetings that she's held and procedures moving forward that was agreed upon by the committee. And then third, we have Mr. Griffin and Mrs. Caitlin Disler, who is the coordinator for student for the Chief Information Office. And both of these individuals will provide to us today and should provide a quick demonstration of our ABM teacher workforce flow. I'm echoing. Survey. Can you
echoing.
hear me?
It's
Okay. Yeah, I heard that. And fourth, Madam Chair and Board, we would call on Mr. West. Thank you. We will call in Mr. West, who's our Chief Human Resources Officer, and he will provide for us an update, an HR update for the board. So now I will call first on Ms. Patricia Boswell.
Good morning, Madam Chair, members of the board, superintendent, and staff. My name is Patricia Boswell. I'm the administrator for the Florida Department of Health in Volusia County. As of August 9th, Florida has 536,961 total cases of COVID-19, of which 30,785, or 6% of our cases in Florida, have had residents have had hospitalizations associated with the virus, and there has been 8,277 deaths of Florida residents, or 2% of all cases. In terms of Volusia County, as of August 9th, we've had 7,960 cases, of which 7,904 are in Florida residents here in Volusia County. We've had 577 hospitalizations of our residents, which represents 7% of all cases. We've had 135 deaths of residents, or 2% of all cases. We have had 850, or 11% of all of our cases, associated with long-term care facility staff and residents. And there's 141 facilities here in Volusia County. We've also had 221 cases related to correction facilities in Volusia County. When it comes to the median age, it's 43 years. When it comes to cases in age groups, we've had 107 cases in our 0 to 4 group, with 1 new case on August 9th, 4 hospitalizations, and 0 deaths. For the 5 to 14-year age group, 274 cases, 2 new cases on August 9th, 2 hospitalizations, and 0 deaths. And for the 15 to 24-year-old bracket, there's been 1,220 cases. We had 9 new cases on August 9th, 17 hospitalizations related to those cases, and 1 death, and that was a 23-year-old. The 0 to 24 age groups represent 19% of all cases. The largest percentage of cases fall within the 25 to 34-year-old age group, which is 18%. We also have 17% of our cases in our 65 and up age group. When it comes to the cases, in terms of those 18 years and younger, it's 7% of all cases, 544. We've had 3,872 individuals under the age of 18 tested, which represents a 14% positivity rate. To date, there's been 74,295 persons in Volusia County tested, with an overall positivity rate of 11% from the beginning of this event. We are looking at a positivity rate for the 14-day range of July 27th to August 9th of 7.3%. That's down from the 14-day range from July 23rd to August 5th of 7.41%. And the last 2 weeks in July, the July 17th to July 30th, we're at a 14-day positivity rate of 9.37%. So we do see that our trends are improving when we look at emergency department and freestanding emergency departments, chief complaint and admission data for Volusia County. That includes visits mentioning cough, fever, shortness of breath, influenza-like illness, COVID-like illness, or cough-associated admissions. All trends are downward trending, which is good news. When it comes to our contact tracing and case investigation. We are very aggressively hiring new staff, and we have new staff starting almost daily. And so we expect 20 additional staff on board over the course of the next couple of weeks before school starts. And with that, I'll take any questions.
Thank you so much for that. Colleagues, do you have any questions? I'll start with you, Ms. Haynes.
Good morning, Ms. Boswell. I appreciate the update that you have provided us. And I also want to say thank you for breaking it down the way you broke it down. So my question is about how many staff do you currently have prior to the 20 additional staff that you're in the process of hiring that are working for you with the contact tracing?
Hold on one moment while I grab that document.
Thank you. I turned it off.
Okay, so during blue skies, which would be pre-COVID, we had 4 epidemiologists on board. That included the supervisor of that group. Since then, we've added 4 Masters of Public Health students, and currently 2 have remained with us. The other 2 have returned to school.
Okay.
We've also been allocated 45 new positions, of which 21 will work on contact tracing and case investigation. We also, in addition to those 21, have 12 nurses that we plan to hire over time, and they can be reallocated to help with contact tracing and case investigation if the demand so warrants it. They would basically initially hire to help with testing, but they can also help with that case investigation and contact tracing. So of the 21 that were earmarked for this epidemiology response, I believe at this point about half are on board, and the other, we've identified everybody that we're going to hire. So it's just a matter of when they've given notice and when they're coming on board based on their work schedules as well. So I would say in the next 2 weeks, with HR running smoothly, things going as expected, we would see the rest of them on board.
Okay, thank you for that update on that piece.
You're
So as far as the testing going on at the health departments, last time you reported that your turnaround time appeared to be quicker than some of the testing sites that are set up in other areas. So are your turnaround results still within a smaller time frame that you're getting responses back to people when they're tested?
Yes, so our goal is basically to, by continuing, the Department of Health is continuing to build their capacity at the Bureau of Public Health labs, and we use the Jacksonville lab. So right now we expect a 48 to 72 hour turnaround, but with the capacity building that's happening currently, we're hoping that we can prioritize our testing for the schools and have a 24 to 48 hour turnaround.
Thank you. And I appreciate that you're working on that so that we can have a much shorter turnaround time.
You're
At this, so at this time, I thank you for joining us again today, and I'm going to allow my other colleagues to have an opportunity to ask you questions.
Thank you, ma'am.
Thank you, Ms. Haynes. Ms. Cuthbert?
Thank you. Thank you, Ms. Boswell, silently as well as vocally. I appreciate you coming today. And I also thank you for speaking up and on behalf of all school districts in the state of Florida, because we are fully aware that you have been silenced, as was in the headlines of the News Journal on Saturday morning. Health directors silenced. I appreciate you speaking up. As a result, that we do know that health directors were instructed by our governor not to say anything or to give school districts advice. Are you able to say anything to help us be proactive today besides the CDC guidelines that you have given us? Is there anything else you can assist us with and any other proactive guidelines to make sure that when we open our schools, they are as safe as possible?
Well, I stand ready and serve as a resource to our Volusia County School District in how we can open to schools in the most safest manner and what mitigation strategies to employ at the time and the manner which works for our school district, what's practical and feasible as well. And I understand, and my agency understands the importance of supporting all families in our district with different methods of education based on the individual students' and families' needs. And so we stand ready to work collaboratively with you, the superintendent, and our families in not only providing data and trends, but also education and mitigation strategies and supporting whatever happens in the future in terms of the need for contact tracing, case investigation, and testing.
That's very vague and very general. What specifics can you give us?
In terms of
Well,
the role that
you said you would help us with support and mitigation strategies
public
besides
health.
and public health, because you've been very open and very honest in the past about any other infectious diseases that we might have had. Is there anything more that our school district can do besides the CDC guidelines and the mitigation strategies that have already been given out to most everyone in the country? What is so unique in Volusia County that we can keep our numbers down? The downward numbers are fabulous, but it's all based on how we can work together as a county. Everyone has to do all of this. What else can we do besides, because it's very difficult to ask school children to be 6 feet apart. That is not the nature of education. What else can we do besides masks and 6 feet social distancing? Is there any other support? You said you would help us with support and mitigating strategies. What other strategies do you have to offer?
Certainly the hand washing and the basic ventilation, those other mitigation strategies, and I'm not sure that that's the answer that you're looking for, but also just monitoring closely and responding quickly to any case in a family or a student or a staff member or faculty at the schools in terms of how we can hopefully ensure fewer exposures.
Okay, according to the HIPAA law, though, you said on your sheet, to help slow the spread of COVID-19, the health department and the schools will work together to notify students, parents, and staff members when an exposure to COVID-19 has occurred at a school. How exactly will that take place? What is the policy?
So basically, what we do is we notify that a person has been tested positive for COVID. We begin our investigation, identifying the individuals who may have had close contact with the virus. Those individuals are self-isolated for 14 days after the exposure to the virus. And then we basically will work providing guidance in order to make sure that they understand how to care for themselves. And we will protect the identity of any individual tested or affected by COVID and ensure that their personal health information is protected. But we will work closely with your school health services, principals, and those individuals that have a need to know of the situation. And I imagine every case is going to be very different. It's going to be based on where the child was, who they were around, the age of the child, whether or not the exposure happened in school or in the community or at home. So it's going to be a case by case basis.
Well, how will schools know? Are you, who's, when you receive a positive case from an individual, whether it's an employee of Volusia County Schools or a student or even a parent of a student or family member, when you find out, what is your next step?
So we have developed letters. They are not ready for release. I expect them any day now, but I did receive drafts from the Department of Health of letters that are going to all school districts across the state. They're letters to parents or legal guardians, as well as to staff and administrators at schools that are notifying them that they themselves might have been a close contact, or that there has been someone in the school that's been a case. So I think that it's going to be through this draft that's hopefully finalized this week, letter notifying, and it's going to include some education as well as information as to next steps for those impacted.
Okay, what I'm trying to clarify is, how do we know we have a proven positive case on our campuses, whether it be an employee or a student? How do we know when we do temperature checks, if someone is not showing any symptoms, that when that person goes through our campus door that morning, how do we know that that person has been tested positive, so we can say, please, we can't accept you on campus today? And I think that is the largest question I hear from teachers, from parents. We don't know how that information will be disseminated because we're not getting clear instruction. When I'm asked in emails, what do we do if a teacher's tested positive? Does that teacher go home for 14 days? What happens to all of those students? What happens to the spouse who might be teaching, and to the children of that one teacher? Does those children stay home? Maybe they were in elementary school. So will that draft establish clear directives so that we can follow them and help reduce the spread?
Yes, I do expect that. So basically, if we are aware of a case before they get on the school property, we will talk to the parent about the importance of keeping that child at home, and for the number of days that child would need to stay at home. So depending on if you have COVID, if you're a case, we're going with symptom-based clearance now, which means that you have to you remain home 10 days from either the time symptoms first appeared, or if you were asymptomatic from the time you were tested positive. That's with the fact that fever has been, your fever has, you haven't had a fever for 24 hours and that symptoms are improving. So those three situations have to happen before somebody can leave their home who's had COVID.
So it all depends then upon the compliance of the individual who's had COVID.
And it has from the beginning of this event. Everyone is, we can see basically when someone is informed that they have tested positive and they isolate themselves and they don't expose family members, colleagues, or residents by going out and coming into close contact, we know that stops the spread of this virus. When people are either not aware that they're infectious, or they're not personally taking the responsibility that's expected of them and isolating, then that increases transmission. Now, part of our job here at the health department is to call the individuals who have tested positive, talk to them, educate them, let them know that this is what the next steps are in terms of isolating and for the extent of time that would be required. The same thing with a close contact. And I think that the close contacts are probably the more difficult group because they're not sick and they don't understand why they have to remain home for 14 days.
Okay, so really, schools,
And
just like any private company, we are totally dependent upon the honesty of those who've been tested positive, correct?
as far as the community goes, yes. Now, certainly we, when there's cases and outbreaks in schools, we're working very closely with your administration, your principals, and those people that have a need to know.
Okay, because I'm very concerned about the communication, because if someone is tested positive or gets the information that afternoon, they almost have to know right away so that person is isolated and does not return. Or the people in the contact tracers have to double check to see what classes that person was in to notify all of that. When you have all your full staff within the next 2 weeks, is that your goal? I mean,
My
to make
goal,
sure.
yes, my goal, and we've been trying to maintain this goal. It was easier in the beginning than it was, in July when we had such a large number of cases, is that when we get a positive result, that we act immediately on notifying that individual of their test results, educating them in terms of what the next steps are in terms of staying home until they have a symptom-based strategy, and that's what we're using in terms of clearances. Now I know that there's a desire to go out and get a negative test, but because the fact that depending on where you are in your infectiousness, it's more important to keep people that are infectious home than to keep people home until they have a negative test, because we know that the PCR is so sensitive, it's picking up fragments from individuals weeks beyond the onset of illness. And they don't have to stay home for a month. And we've heard story over and over again about, I tested positive now 3 times in a row, can't get a negative test, and I've been home for 4 weeks. That's not CDC guidance right now. CDC guidance is you test positive or you have symptoms. Once your fever breaks, your symptoms begin to improve, it's been 10 days since onset, or the test results have come back, you're able to go, you're no longer infectious, is what the science is telling us.
Okay, and those procedures will be in that letter as well?
Yes.
Because,
Oh, yes.
because everyone needs to know exactly what their role is. But
Yes.
we ourselves, if we see a student or an employee, we suspect signs, whether it's a cold or anything, what should that administrator or nurse do on a campus?
Well, I think the first most important message that we need to share with our residents is, if you're sick, stay home. And there's no consequence for doing that. If you're sick, stay home. If we can keep people who are sick at home, again, that's going to slow or stop the spread of that infection. If they arrive into our schools and show symptoms, like you said, these symptoms resemble a lot of different illnesses. It could be allergies and whatnot. So if they're basically arriving to our schools feeling ill, they need to be isolated. Our school health staff need to understand the importance of taking precautionary measures, being around that person, and then that person is isolated and sent home, and then hopefully they'll go see a healthcare provider if it warrants it, or remain home until they're feeling better, or if they go get a COVID test and find out that they have that they've been infected, then they follow the guidelines in terms of clearing.
Okay, so what would be a good idea then for them to contact the Department of Health, maybe schedule a COVID test in order to get that rapid return?
Yes.
Correct? Okay.
Yes.
So, and that's what we need to advertise. Thank you
Well,
very much.
I wouldn't advertise it in terms of, I think it's a conversation between the individual the school health nurse and the health department, because we want to make sure that we're able to prioritize testing for our schools. So
Yeah,
as far as the public is
yeah.
concerned, our testing is ending on August 21st.
Really? So your testing is ending on August 21st
For the public.
for the public. So what does the public do after that?
There's testing throughout our community, and you can go to volusia.org /coronavirus, and all the testing sites are available there. And there will be another, I'm expecting an announcement at any time with a large testing site opening in the county.
Okay. Thank you very much. Thank you, Madam Chair.
Thank you, Ms. Cuthbert. You got a quick question, Ms. Haynes? Go ahead.
Ms. Boswell, you said that your testing is ending on August 21st. Is that because at that time you're taking over testing individuals on the school sites, or you're not testing anyone?
Our testing will be prioritizing for the school to support the schools in their reopening. And so when there's indication of a need for a COVID test related to a school, will be available and have the resources available. And there's basically making sure that we're able to prioritize is what our Surgeon General has asked us to be able to do for our school districts.
Okay, because I just wanted to clarify that. So right now you're still testing for anyone in the public,
Yes.
but starting August 21st, you're
Ending
encouraging.
August 21st.
Oh, okay, ending August 21st. At that time, you're encouraging the public to go to one of the other testing sites, because you're going to prioritize testing from that point on for our teachers and staff and students that are on school campuses.
That warrant testing.
That warrant testing.
Yes.
So you're going to make them a priority.
Yes.
With the shorter turnaround time. So thank you very much.
And hopefully, yes. Yeah, hopefully by then it will be 24 to 48 hours.
Okay.
The best case scenario with testing is if we had at-home, inexpensive testing, self-administered, that we could do every day before we walked out the doors. That would be the best case scenario. We're not there yet, but hopefully someday.
Okay, but thank you, because that's much clearer now. I think I didn't want there to be any confusion to say that you were going to stop testing. It's just you're going to no longer be open to the full public because you're going to prioritize schools. So thank you.
Yes.
And I appreciate the fact that you're going to make us your top priority starting on August 21st. So thank you very much. Thank
You're
you,
welcome.
Madam Chair.
Mr. Persis?
Thank you, Madam Chair. Good morning, Ms. Boswell.
Good morning.
Thank you again for your great partnership, Ms. Boswell, with Volusia County Public Schools. We sincerely appreciate it. I wanted to piggyback on what Ms. Haynes and Ms. Cuthbert were talking about in regard to the testing. We hear so much about rapid testing and that you know the kind of testing that perhaps President Trump gets every day. What's the likelihood that that type of testing will be here for us to use?
So, we talked about it yesterday on our statewide call, and certainly it is available in Florida, but it's limited. We don't have the machines, and we certainly can't do it at the health department. But I think that that's the way testing needs to go, is rapid point of care testing, and people understand whether or not they're infectious with this virus, and then take the appropriate steps accordingly. So I'm hoping that that there's more of a national push to get FDA approval for some of those tests that are out there. Very promising. They certainly don't have the sensitivity of the PCR, but I think when you look at the benefit of knowing when you go to get out in the morning whether or not you have the virus is far more important than a higher sensitivity of the test, because we're finding, like I said earlier, with the sensitivity being is the gold standard that it is, we have people testing weeks after their infectious period ended.
Yes, yes, that would be fantastic. Dr. Balgobin, I know all the superintendents are waiting for the State Department to give us clear guidelines and protocols where to follow when, after we start the school year and a person, we become aware of a person has COVID, what exactly we are to do. And I really appreciate the Florida Association of School Superintendents asking those specific questions so that every district handles it the exact same way. So I'm assuming, Ms. Boswell, that the health department, state health department, will certainly be involved in whatever those protocols are. And I don't think we've received it yet, have we? No. So we have not. But obviously, those will be forthcoming as some school districts are underway. And I just think that the expectation has to be, when the school year starts, that people are going to have it. You know, there are going to be children that are going to get it. There are going to be employees that are going to do it, that are going to have it. School is going to start, and some classes are going to stop and restart. In some cases, it may be just a class, some maybe two, it may be a whole school. But I don't see it to the point, as long as our community continues to pull together and wear their mask and get this infection rate down. I don't see us into a situation where the whole district shuts down. It would have to be pretty widespread for something like that to happen. So that's why my question was, we all need to follow whatever these protocols are that come down from the state, and so that we're all doing it safely, correctly. And I think that would give our employees and our parents a great deal of comfort too, that we'll be following the best science out there about what to do when in fact we become aware of a COVID case in one of our schools. So thank you again, Ms. Boswell. Greatly appreciate your partnership. Stay healthy.
Thank you.
Thank you, Mr. Persis. Mr. Cologne?
Good morning, Ms. Boswell. How are you today?
Good morning.
Morning.
Well, thank you, and I hope you are doing well.
I am excellent. And so I do have some questions. If you don't have the answer, you can say, I'll get back to you. That's not a problem. I didn't get a chance to send these to you in advance. So if we don't know the answer, that's okay. So currently you said our 14-day rate is down to 7.3%. What is our positivity rate right now for 18 and under, which are typically the students that we serve?
The 18 and under is at 14%. And that's based on 3,872 tested under the age of 18 and 544 of those being positive.
Okay, and our 14-day rate was 7.3. Are there any extrinsic factors that the department is attributing to that decrease? You know, starting with the tropical storm, of course, that had a few days that we had the drop, and you know, we've continued to decrease that number, which is good news. But are there any factors that have played into this decrease that we may not be aware of?
I'm hoping that we're just seeing less transmission happening. I mean, that's why we monitor all these data trends so closely, is to help us understand what's happening in the community with the transmission of the virus. So with the hospitalization, the ED visits, all those data points trending downward, as well as our positivity rate, we're hopeful.
Great. Um, Based on the CDC guidelines, what is the current level of spread in our community? Is it substantial? Is it moderate? Community spread, minimal? Where are we sitting right now? Where are we defined as?
I'd want to get back to you. The last time I looked, we were at substantial.
Okay. And so it's my understanding that to get out of that substantial, I think we got to hit 5%. And so, um, and mind you, go ahead, I'm sorry.
Oh, no, we were using that 10% has been the federal number for quite some time that we wanted to get below.
Okay, so 10%. And is that looking at the 14-day rate? So now we're at 7.3. Are we talking the same language?
Yes.
Okay. So we are probably now at a moderate. And again, these are defined by the CDC.
And I'd like to confirm that, and I'll get back to you.
Perfect. What is the current mitigation effort that we should be doing for, we'll talk about moderate spread. Let's just say we're probably there. What should we be doing as far as schools go based on that definition of the community spread?
Social distancing, mask wearing, hand hygiene, limiting large gatherings, cleaning, ventilation, and creating small cohorts of students.
Okay. And so that's great, because I know a lot of teachers are going to go back and listen to this. Of the 14%, and if you don't have the answer, that's okay. Do we know what the ethnic breakup was of those children?
No, I have it for all almost 8,000 cases. So 45% of our cases are white, 9% of the white listed Hispanic as ethnicity, 13% Black, 20% other, and then 22% unknown race.
Okay, got that. And currently, what percentage of the cases have you all successfully contact traced? Do we know?
All right, so I will be estimating this.
That's fine. We're still quite a bit a ways from school starting, so I'm sure we'll have these questions as we get closer to the start of school.
So when you look at the fact that we had about between Friday, Saturday, and Sunday, 100, 200, a little more than 300 cases, and they had yesterday, we did have people working on Sunday, so I would say we're probably looking at trying to get caught up on what came in on Sunday and Monday today.
So what percentage? You think you guys are hitting 10%? A couple hundred? Okay.
Yeah, of the 8,000. Mm-hmm.
Okay, when your agency, so when you find out about a positive case, say it's a student, someone of school age, is there a process by which you are able to inform? I mean, typically anybody 18 and under is probably in school. 18 is probably a little bit on the border there. Is there a process by which you will notify the school system so that we can flag that student? Is there
Yes.
a means for doing that?
Yes, we've been doing that for decades with all the other infectious disease that we encounter in our community.
And you mentioned there were letters that were going to be sent out, and we know that by the time a letter gets to wherever it needs to go, it's probably been 2 or 3 days at best. So if an employee tests positive, how will the school district be notified? Will you all use the same channel of communication when you do your contact tracing and they call that person up? Say they went to their private doctor's office. Will you all, and they say, I work at a school, will you all then automatically reach out to us and say, hey, we have this employee who through contact tracing we discovered works at a school and you all should be aware?
Yeah, we have a point of contact, and that point of contact will be the responsible party communicating with your point of contact.
Perfect. And how will your agency release data to interested parties? In other words, if somebody hears that there's a case at one of our schools, the first thing they do is they try to call us. Of course, we don't usually know because we don't have a need to know. And so how will you all communicate this with the media, newspapers, and all of that as it relates to our schools? What should we expect that to look like?
That would be through our public information officer, and it would depend on whether it was an outbreak or not. So again, it varies case by case in terms of how things are shared with the media.
What do you all define as an outbreak?
Well, we're waiting for that. I think it's going to be different than in the past with other infectious diseases. So I think it's going to depend on the particular case and the age of the students, because we know that the younger students are going to most likely be less likely to be social distancing, wearing masks, and all those mitigation. So I would say 2 cases, it probably end up in the outbreak module. Okay.
And you mentioned symptom-based, so that's a little bit different than a lot of the guidelines that we've seen thus far. And I'm familiar with it because that's what we do at the hospital. But could you explain that again for folks who are not medical, who, okay, teacher comes back positive, but they feel good.
Yes.
And they're asymptomatic. What would that look like? How soon could they return?
So asymptomatic, so for them to know that they have COVID, they test it. So on the day that they've got that they test it, they have to wait 10 days, have no fever for at least 24 hours, and have symptoms improved, whatever those symptoms they might have experienced. Shortness of breath, cough, have to be improving. So if it was someone who had not tested but had just symptoms, and it's symptoms from the first day that they appeared, they would wait 10 days.
So 10 days, which for us is 2 weeks as far as school goes.
Yeah.
So focusing back on our positivity rate of 18 and under, which would be our community, what would that be considered in that age group as being the spread? Would that be considered a substantial community spread in the ages of 18 and under because the rate is 14%?
I would want to get back to you on that answer to make sure I give you a solid answer.
Great. And I do realize that, usually kids don't get tested for COVID just for fun. Usually they get tested because they are not feeling well and they go ahead and get tested. One last question. Are you at this point, because I know we've gotten varied answers on that. Do you receive the negative results from all of the labs, all of the private labs that are doing COVID testing? Do you receive the negatives, or are those not a part of the denominator, thus making the percentage look worse than it really is? So are you getting that information? Because as you're cutting back on your testing, which is still very concerning because, we're still not at a no community spread or even a minimal community spread. One of the things that were highlighted in the president's plan for reopening our country actually spoke about continuous available testing. And so I realize that that's not a local decision that you made in Volusia County, and I appreciate that you all are putting the efforts towards us, but we're depending on this testing being consistent and readily available. And I'm kind of concerned that it's going to go away. And so, yes, we'll be able to identify more cases, but what's going to happen as a result is you're going to have more positive results and our rate is going to go up because you're only going to be testing people who are not feeling well. And so as we move forward and look at opening schools, yes, our 14-day rate is at 7.3 and 14% for 18 and under, but that's going to go up if you're no longer testing everybody and have that denominator of negatives to outweigh the positives. So I'd be curious to see in the future as we get closer to our opening of school, what will that look like in scope? Because again, because you're going to be mostly testing symptomatic folks who were either exposed or are not feeling well, that percentage is going to skyrocket because your denominator is going to go down. So I'd be curious to hear what moving forward, and I get that the department has not set any milestones or targets to say, if this happens, this is what you should do. If that happens, this is what you should do. But I'm concerned, and again, I realize that the decision to not test in the community is not a local decision, not something you decided. So just if we could just keep our eye on that, because that rate is going to go up, and then it's going to be a real hard argument to open schools when for 7-9 days, all you're really going to have is folks who are symptomatic who or part of the school district that are going to be tested. So other than that, I have no other questions, and I look forward to hearing a response back whenever you get a chance. Like I said, we still have time before school starts, and we have to look at making a decision. So thank you so much.
And I do want to assure you that we do get negative tests. We have 66,226 negative test results to date when it comes up when we arrive at those positivity rates.
Right, but if you all are going to start closing your testing to the public throughout the state, then the folks who are going to come to the department are mainly going to be referred to you by school districts, which means they're either been exposed or they've been symptomatic. So you're going to have more sick people, arguably, or concerned people, will say, coming to you for testing because of the school system. So you won't have that denominator of all those 66,000 negatives. And so that positivity rate can only go up then. But, again, that's all a matter of math. But we'll see. Thank you so much.
Thank you.
Thank you.
Thank you, Mr. Cologne. But I want to make sure I heard you right. Even though you, or as our public health department, there are facilities that will be providing testing to the general public, and you still would receive that information. Is that correct?
That is correct. And there is an announcement happening today about a large testing site that's opening in Volusia County. So I certainly made my decision based on having that information. We're not a major testing site in Volusia County. I think that our urgent care centers certainly test more than we do, and private doctors, of course. So and hospital systems. So
Mr. Cologne, I think we'll probably even out, because I was certain she said that there was going to be a large facility.
Yes.
So the general public will be able to go there, but you still receive that information so that you can include it. Okay. All right.
Yes.
So I think they've asked all of my questions. Thank you, colleagues, for all of your questions. I see you, Miss. I see you, Miss Cuthbert. I asked all of their questions. If I feel like you're in the hot seat, Ms. Boswell, and actually you really should not be, because you're providing us information. Some of this are some of the policies that we as a district should have in place. But go ahead, Ms. Cuthbert.
Thank you, Ms. Boswell. Sorry to have to come back. I noticed I asked you a question about the point of contact, and so did Mr. Cologne. Does that point of contact have to be from our district, correct? That's our district, not our school-based contact?
I believe it's through school health services.
Okay. And then they will disseminate through our own school district. So you have basically one point of contact, and then it's up to our school district to disseminate that information, correct?
Yes.
Okay, thank you for that clarification. I do want to ask you your advice for something about our bus drivers. I know they are driving. They are also greeting students when they come on board, and they come very close to the driver. What advice can you give to us to help protect our bus drivers from the students who first come onto the bus, but also be able to drive appropriately? Any advice you can give us?
Well, I would certainly recommend the mask wearing as students are boarding and getting off the bus. But certainly if those seats right behind the bus driver could be reserved and kept vacant to protect, give him that 6 feet. The social distancing, the 6 feet is really so important to stop the spread of this virus. So however you can keep the children 6 feet from where he's sitting and driving, I would recommend.
Okay. Thank you. And the last one, based on everything you've heard from all of us today, can you advise us whether or not we should open or not?
I'm sorry, but that's not my role as your health officer. And I can provide guidance on how to make the schools as safe as possible for your staff, faculty, and students.
Thank you very much. Thank you very much, Ms. Boswell.
You're welcome.
Take care.
Thank you.
Thank you, Ms. Boswell. Thank you for joining us. Dr. Balgobin?
Thank you, Madam Chair. That's fine. I think it's good. Now we have next with us Mrs. Rose Rowland. Rose Rowland is our Assistant Superintendent for Student Services. She's met with the MAS committee and she has an update for us. Mrs. Rowland?
Good morning, Chairman Wright, school board members, Interim Superintendent Dr. Balgobin. During our last board meeting, I agreed to put together a committee to collaborate and share ideas as to how we should move forward with Policy 503, which covers mandatory facial coverings. The policy states that facial coverings must be worn by all students, employees, visitors, vendors, or any other persons while in or on school board property. Where social distancing guidelines from CDC cannot be maintained. This includes, but is not limited to, school buses, class changes, cafeteria lines, in confined quarters, or any other places where social distancing guidelines cannot be followed. Our kindergarten and younger students are not required, but are encouraged to wear the facial coverings as well. We put together a committee, and the committee was comprised of principals, parents, and students. I originally didn't have students included, but I'm glad that we decided to. One of the board members asked, could we please add student voice as well? So we did. There were 16 principals, 21 parents, and 13 students. The meetings were very informative and very productive. Everyone was on the same page, and they were in good agreement with what each person suggested. What we will do, everyone will be provided with the Policy 503, and a compact agreement will be developed for all students choosing the traditional setting. This agreement will outline the responsibilities for the parents, students, and the staff. And what I would like to start with this morning is a couple of comments that were made by the students that were involved in these meetings. One of our middle school students said, students should be sent home to enroll in Volusia Live. This is their warning. Students refusing to wear a mask should not be allowed to pose a risk or hazard to their classmates. That was from a middle school student. A high school student said, I am thankful that I have the opportunity to attend brick and mortar setting that is being offered so that I can be educated and learn in the most normal setting possible. There is an option for students not wanting to wear a mask for Volusia Live. So the students were very informative. They were happy to be participants on these committees, and they were very vocal about what they wanted as far as the mask wearing was required. Okay, we'll go to what the elementary school responses were. Elementary school responses were students reporting to school without a mask will be provided with a mask as long as parent contact can be made. And the elementary school principals were willing to provide masks to the students because they know that kids will come to school, they may lose their mask, they may break their mask, so they were willing to provide the mask to students as long as it was sustainable to do so. They also wanted kids that were refusing to wear masks to be placed in isolation with social distancing, along with parent contact and written warning, as long as they had space for children to social distance. Otherwise, we may have to call parents to pick the students up. Students refusing to wear a mask after being provided with one will be sent home. If parent refuses or does not agree with the policy, they're suggesting that a school social worker contact the parent to see if there are other issues that are going on at the home that they may be able to interview and support that parent. And after the third refusal, the parent said that it becomes a distraction and is disruptive to other students. And parents should be required to pick students up from school, and a change in setting at that time becomes necessary. Students should be enrolled in Volusia Live where masks are not required. So when we go to our middle school, middle schools were just a little bit tougher. The first offense, they wanted to do a warning, provide a mask, and contact the parent. And if the student refuses, the parent must pick the student up. For a second offense for the same child that refuses to wear a mask, they'll provide a mask for a second time and contact the parent. Their third offense for refusal and second offense for refusal, they think the student should be sent home on Volusia Live for 14 days to think things through, and a re-entry meeting be required upon their return. And the third offense of refusing, they want students to enroll in Volusia Live where masks are not required. Okay, our high school. Our high school principals and students and parents agreed that a first offense, they'll provide a mask for the student. They would document the names of the students that are coming without a mask. Refusing to wear a mask, the parent must pick the student up. And they mentioned that the age of the students in high school, they know the requirements of policy 503 and they should be able to abide because the policy will be out there for them to review and be able to either select to take a mask from the school or purchase their own at their choice. The second offense, they'll provide a mask and contact a parent for a second time. And after the second time, they think it's continuous refusal and it becomes a health issue. Refusal is disruptive to classmates, faculty, and staff. Students who continue to refuse to wear masks are making a choice to refuse. It's their choice to refuse. Students must enroll in Volusia Live where mask wearing is not required. The student or students have made the decision to refuse wearing a mask. So the parents, the teachers, the principals, and the students are all in favor of requiring the mask to be worn during school hours where social distancing is not able to be maintained. Now, any questions?
Go ahead, Mr. Persis.
Thank you, Madam Chair. Could you put the middle school response up there? I was questioning the rationale for the 14 days.
And most of the parents and the principals said that it becomes a disruption for the school, and with the manpower they have, if they have to keep reminding the same students to wear masks on a daily basis, it becomes overbearing to maintain that task on a daily basis for kids that know they should have on a mask. And they just thought if the kid can get 14-day timeout to think about it and decide whether they want to wear the mask or not.
I guess you see it says second offense, provide mask and contact parent.
Yes.
And then it says refusal in second offense. So does that bullet go along with the second offense? Like it's the second offense and the child doesn't want to wear the mask?
Yes, refusal and a second offense. They want the kids to go home on Volusia Live for 14 days and have a re-entry meeting with the parent. And the third offense, the student enrolled in Volusia Live where masks are not required.
Okay, I don't know. To me, the 14 days seems a little long.
Okay.
I think you could get the same. Parents will figure it out in 5 days.
Okay.
I mean, it's 5 days and you can come back. I think you send the message pretty quickly in 5 days.
Okay. I can take that back to them.
Yeah. Thank you. I think this is great, though. I think all this is good. It's great having the students' reaction to it, as well as the parents and principals. But thank you, Ms. Rowland.
You're welcome.
Thank you, Mr. Persis. Anyone else would like to comment? Go ahead, Ms. Cuthbert.
Thank you, Ms. Rowland. I'm thrilled to have all voices heard from principals, teachers, parents, as well as students. So thank you so much for doing
Thank you,
this.
Ms. Cuthbert, for making that suggestion to add the student voice, because it really did make a difference. I think it kind of kept the parents and the principals kind of,
Grounded.
it kept it grounded.
Grounded.
They were
It
grounded.
did. That's a good word. It did keep them
Yeah.
rounded. Yes.
And
That's
I
it.
noticed your middle school consequences are much more strict than high school. I think maybe you think high school is a little bit more lenient because there isn't a third offense mentioned. It just says students who continue to refuse to wear a mask are making a choice. So can that be interpreted 4 times, 5 times? I think that needs to be clarified.
Okay.
Yeah, it says second offense, provide mask and contact parent. Continuous refusal becomes a health issue. I think that third time, maybe third offense, continuous refusal becomes a health issue.
Okay.
Because otherwise, you have that I just would like to see if there's a consistency between elementary, middle, all the way to high school. Because you're allowing those much more wily high school kids to kind of wiggle out of it.
Okay.
Yeah.
Yeah, because it's so very important that we're very strict, especially at the high school, because it seems those numbers are higher in positivity rates. So they need to be held a little more accountable. So.
And I did speak with a couple of the elementary principals that had the summer programs on their campus, and they said the mask wearing was not a problem when those kids came to the summer camp. They said 90% of those kids got out of the cars with their parents and they had masks on. And for those that didn't, they did provide the mask for them. One of the concerns from all 3 levels was the sustainability of providing a mask to students every single day. They don't know how long that can be sustained if it continues to happen throughout the school year. Hopefully this is a short term, but they do worry about sustainability at this time of maintaining, continuing to give out the supplies to the kids that come without them.
Yes, and we were talking about that when we were discussing 503, and it seems as though we were concerned about the sustainability because of funding. So we can do a 1 to 2 week or first 2 weeks, and then after that, it's just for maybe emergencies only. So as long as our schools are all told the same thing, that would be super. But yeah, but from what I thought, 14 days is pretty long too. I think maybe the 5 days out, that might be enough. But then, of course, the third offense is they said you can't do it after coming back. That's what you're going to have to go back to. But middle school, those little stinkers are going to try to worm out as much as they can. I don't blame them. But high school kids will do the same thing. They will do the same thing. So we need to tighten up, at least make middle and high school more comparative. So that's all for secondary. But thank you. This is wonderful. Very clear. It's either yes or no. So thank you.
Ms. Haynes? Thank you, Ms. Cuthbert.
Good morning, Mrs. Rowland, and thank you very much for your presentation. And I do appreciate the time that you took to put all of these individuals together and ask these questions, because I know that your schedule's been very busy and we added to it when we made this request. I do agree also, I think maybe 5 days out on that second offense at the middle school could be enough to see whether or not they want to return. And we may find out that they don't wish to return, and then they'll go ahead and stay at home. 14 days is just, that is almost 3 full weeks of school out when you're looking at 5 days a week. So I would like, if you don't mind, that you ask the committee to consider that first offense of going out to Volusia Live to be reduced to 5.
Okay.
I actually, when you look at middle and high, I think I think the guidelines for both of those should be very similar because we're talking other than sixth graders, okay, which, walk into middle school and and because years ago they used to be in elementary, they just aren't quite sure what they're doing. I really think when you're looking at 7th through 12th graders, they have the capability of understanding the choices that they make, and parents need to have some very strong conversations with them. So I would just like to see, if possible, if the high school principals or the high school group goes along with it, that those two kind of mirror each other more in what we're doing for first, second, and third offenses. Because maybe those high school kids may need to go home for 5 days too, if they're refusing to do it on the second time. And then if they wish to come back, hopefully they'll come back and they will follow it. I do appreciate how clear the elementary was. I like the fact that they talked about involving our school social workers, and making some contact, because when you're looking at little people, that's an entirely different thing. Because sometimes it's just that they're just impulsive, okay, and they don't really understand ramifications, or when they're making a choice, what it means, because they don't see beyond themselves. And lots of times what's happening at that level is it's really what they're hearing at home from the parent. Right. I have a niece who just has turned 11, and when she comes to see me, I know what she says, she spews things at times that it's exactly what her mom said, okay? So I know it's not a decision she made or came up with, but it's what she heard her mom say. So I do appreciate that social worker piece. The only thing that I don't see anywhere in here, and maybe it doesn't need to be here, but I just have to bring this up, having taught at all 3 levels and having also taught in a separate class ESE during my career, there's nothing here still that says we are going to look at the individual needs of some of our students. Some of our students that are in wheelchairs, some of our students that are autistic or very autistic or have Down syndrome, because the CDC guidelines, which I have read numerous times, and I read the updates that come out from them, it's very clear in there that if an individual, whether it be a child all the way up through an adult, if they cannot put a mask on or remove a mask by themselves, then they should not be wearing a mask. And having been in multi-VE rooms and knowing at times we have students there that have a lower intelligence level, may not have the capability to, like, they can't even move their hands or their arms, they're wheelchair bound, they're fed by an adult, they're changed by an adult. One of those children, they can't put on a mask or remove it. And I believe those guidelines exist because what if all of a sudden they're struggling with breathing and they can't remove that mask that we forced onto them? So I just need to know where that falls in here, because I still go back to, we can't make a 100% this is how this falls for every child without looking specifically at those children.
But Ms. Haynes, I disagree. I thought we had in the policy that if they provide documentation or a form, they can get a waiver. So why would those children not have a waiver?
Okay, so we're going to hold by that. Like, the waivers doesn't have, as long as they have a waiver, we don't have to follow this.
That was my understanding. Is that everybody else's understanding, colleagues?
Okay, then I'm good, because I'm just reading emails and seeing on social media about people saying it's 100% or they're not allowed in my room.
Now, what I will do, I will include just a statement on the bottom where that students are allowed to have a waiver. They should have a care plan as well with the nurse on staff at the school. So I would definitely add a statement to that effect on the bottom of these slides that I have.
All right, thank you.
That is important. Yes, ma'am.
Anything else, Ms. Haynes? Thank you, Mr. Cologne.
So I found it very interesting that these were to come back as the recommendations because they mirror probably everything else in our code of conduct. Though we said this wasn't this is a health policy. I know we've mentioned several times, to the amount available for masks and all of that, but the bottom line is we can't run out of masks. And masks are readily available. You can order them now. I at work wear simple paper mask. This isn't a super mask, doesn't have 26 layers of carbon or anything in it. And those are readily available for purchase now. So the thought that we may not have one to give a student is probably not an option because then you're going to have a kid without a mask. So I think, Ms. Balgobin, we should definitely figure out ways to source those masks. And, there's they're out there now. It's not like the beginning of COVID. When I look at the middle school and the high school policy, I see the same intent in both of them. And so I agree with everyone else who said that those should probably be a little bit closer. I do have a question. When we are saying we're going to send the student home with Volusia Live, that is us changing their setting. So would we then have to provide them a laptop to be able to continue their education? Because they're not suspended. They are just, we're changing their setting. And so, what was that? I'm sorry. And so we're changing their setting. And so I'm very concerned with that because I think we're going to run into a lot of ESE issues because at that point you're changing a student's learning setting because of the mask. So that may be something we have to look at addressing because, you can't just say, okay, you're going to go home and it's a second grader, and their parents drop them off. And what do? Well, you call Department of Children and Family to come get them for what? They're at school. And so I think, we're going to have to look at that and be ready, if that is the case, to have laptops available for students who are going to be sent home, which we know we don't have enough of. So, we'd have to find somewhere to get that from. I don't know if that's considered a suspension because arguably you're being sent home. Arguably we could say because it's Volusia Live, it's not a suspension. I just don't see, and maybe Mr. Pendley can, how do we classify we're sending you home for 5 days, but you're not suspended?
Well, I don't think Mr. Penley needs to clarify that.
Yeah.
They have decided to go home. This is our policy. I think each child and each parent has made a determination. If you're planning to come in brick and mortar, you have to wear a mask. If you say, you know what, I don't want to wear a mask, then they need to either choose Volusia Online or Volusia Virtual. They, again, are making the choice. I think we're spending a whole lot of time on something that is rather clear to me. I'm just saying it to me. Again, the parent, if we call it the first offense, we're giving them a mask. The second offense, we're giving a mask and contacting a parent. And I believe, I agree with all of you, the high school and middle school should be the same. Sending someone home, I just think after the second offense, because it is practical, someone may have honestly forgotten, but you've contacted the parent. But if they continue to be the third time, sending the child home and having a conversation with the parent, listen, if your son or daughter continues to not wear a mask, what option would you like? Would you like Volusia Online or Volusia Virtual? Volusia Live or Volusia Virtual? And then the parent would make that decision because, and we're not suspending, we're still providing them with instructional. As far as the laptop, I think at that time, if a parent, and more than likely would be the parent who don't want his or her daughter to wear a mask if they are unable to be social distance, then I would say they probably have a laptop or a desktop at home. But I'm gonna be quiet.
Okay, and so like I was saying, this came back a lot more stringent than I thought it would. And so those are the concerns that I have is it's, you know, when we send a child home, we have to make sure that they have a computer because if they don't have one, then arguably we're sending them home for 5 days to do nothing, and that's not an option. And so I also like the aspect of involving the social workers because maybe the student doesn't understand the importance. Maybe what they've heard at home has been very politically driven, and so maybe they could help them to understand why it's important. So I am pleasantly surprised at these responses. And Ms. Rowland, you did an amazing job. And I think that our people have spoken and they're the ones who are going to have to enforce this. And we got student input from Ms. Cuthbert's folks. So, I mean, this is good for everyone. So thank you.
You're welcome.
Thank you, Mr. Cologne. Again, thank you, Ms. Rowland, and thank you to all the parents, administrators, and especially our students who participated. I agree with my colleagues. The only thing I'm a little concerned about is the refusal and second offense. Um, I just, again, I don't think sending a child 5 or 14 days is necessary. Again, that is me. I think the first offense, again, we're saying that if they offend, we give them a mask. Second time, if they offend, we give them a mask and contact the parent. It'd be nice if even middle school and social work, high school, we can include the social worker. But after the third offense, we just have the parent had a parent meeting with them and the child and decide what other of the two options is best. I don't see the need of a 14 or 5 days. I just don't. And what do you all think, colleagues? I'm just trying to find out why we're going to do the 5 or the 14 versus.
Miss Wright, the 5 or 14 day was for the kids that were refusing, not for the ones that didn't have. If we give them a mask and they take the mask, they go to class. The 5 day and the 14 day was decided upon because if the same child continues to refuse to wear the mask. So that's what came around refusal.
No, I understood that, but if they're refusing, they're gonna refuse the third time too. So why don't we just go and nip it in the bud and deal with the parent and the child and just ask which option they would like? That's my opinion.
Okay.
Go ahead, Ms. Cuthbert.
I think it's a way for them to try it and see if you like it. It's more or less saying we are drawing a line because of the safety value of the rest of our students and staff. So if they do go home for that 1 week, 5 days, they'll say, well, you know, maybe this is better for me. It's kind of like a test to see if they might like it. And if they don't like it, then they understand how important it is to wear a mask on campus. But if it's something that they do like, well, then they, may not come back. So I think that's because what we're up against is we have no national policy. There's no state policy really, except besides our CDC guidelines. We haven't really had, you heard Mrs. Boswell say that she cannot advise us whether or not we should open or, reopen or close our schools. So the Department of Education is reporting data that is being given to them from the state, and we do know that one young lady was fired from the state who was trying to report accurate data, and they let her go. And our testing after the 21st, the public is going to have to go to a larger area to be tested to help us, which I'm thrilled about to help us, but it leaves the public with fewer options. And with a lot of unclear reporting requirements and the speed to get those results, we need to nip this in the bud right away. And I think this would help those who are compliant. And you're going to have a lot of kids test it, but if they upfront, this is it. We have to follow it. If you don't like it, there are options. We do have 3 options open for students and for the parents, how they want to educate their children. We have to be strong in this mandate. We really do, in order to curb any kind of spread.
Thank you, Ms. Cuthbert. You actually supported why I said, why are we even going to the 514 day?
Well, it's just a way. It's just a way to see, maybe it's something I
I get
might
it.
like.
I understand. I understand. Mr. Persis, I saw your hand, and I see you, Ms. Haynes.
Yeah, I was just going to say, Ms. Cuthbert is right in her beginning comments there. It's just a way so that the parents will see, okay, maybe you didn't feel strongly about your child wearing a mask, and now we're giving you like this second chance. Okay, well, this is what it's going to be like for your child to be at home. Is this what you really want? And you give them 5 days to figure that out. And then maybe that will change that parent's mind, saying, look, you got to wear the mask and you got to be at school because this isn't going to work being at home.
Okay.
And I think that's a way of the middle school. That's why I think they offered that. And that's why I think the 5 days is much better than the 14 days. You don't need 14 days to figure it out. You'll figure it out in 5.
Okay. Ms. Haynes, I saw your hand.
I agree. Kids just don't make good decisions at times, especially in middle and high, or parents. So if you sent my kid home for 5 days, he and I would have a heart to heart on you're going back,
You got that right.
or he would realize I'm missing my friends. I'll go back and put a mask on.
Yeah. Exactly
Mr.
right.
Mr. Cologne.
I guess I have a procedural question. So everything we're talking about here would have to be for further policy, or is this, or
I'll share at the end.
you'll share? Okay, great. Otherwise, I have nothing. That's my question.
Okay,
Mr.
I'm saying because this, what I would say, is more procedural than policy. We've already made the policy.
Correct.
Okay, how are we going to enforce? Okay, all right, colleagues, so that's fine. So, Mr. Who? I don't see him on my
Oh, yeah.
screen.
Yes.
Go ahead, Mr. Penley. I don't see him on my screen.
I just wanted to address, Madam Chair, Mr. Cologne's question. Keep in mind that this was passed as an emergency policy. It's only valid for those 90 days. So we do need to make some decisions here quickly as to what you want to do in the future, given where we're headed, both policy and procedure-wise. If we're going to adopt this, we need to go through rulemaking procedures. So please keep that in mind, board members. Thank you, ma'am.
Thank you, and we will address that in our first meeting in September, Mr. Penley. Thank you.
Thank you.
Any other comments, colleagues, questions? Okay, hearing none. Thank you, Ms. Rowland. Great job, and I'm gonna stay in my lane. Everyone has told me that they need 5 minutes. So I mean, 5 days. So I'm gonna stay in my lane.
Thank you.
Thank you. Thank you so much. We're gonna take it is 11:37, and we'll come back at 11:45. Thank you, colleagues.
Jesus.
Thank you for waiting for us. Dr. Bagabin, we'll let you finish up.
Yes, Madam Chair. Thank you. Thank you, Board. Couple things I want to share regarding the mask committee. You're right. I want to thank Ms. Rowland and her team for putting that committee together and really obtaining some very viable feedback for us here today as we move forward. So the next steps would be the recommended suggestions here today will be presented to the team. So Ms. Rowland will convene the team once again, present those recommendations, and we will streamline our processes moving forward for elementary, middle, and high, so there's some uniformity. Second of all, I want you to know that for students who have a documented disability or a 504 or gifted students, all of those students will have a roster of who those students are if they are enrolling to their traditional setting. And we will have those IEP meetings set up where we would look at their needs and ensure that those accommodations are in place. And that is why we have also not in our policy, mask and face shield, because if there's a small group of students that depending on their classroom, they may need a face shield, depending on what the accommodations require, then we have those available for them. So the committee will make those decisions. Then we will develop our compact agreement, and this information will be included in our compact agreement, meaning that parents will know what their responsibilities would be for the traditional setting. Students will know what their responsibilities will be for the traditional setting, and so will our staff. The compact agreement will be sent out to all of the parents who have enrolled their children into that traditional setting. We will also have orientation sessions for those parents who are enrolling their students into that traditional setting, review policies and expectations before the first day of school for our students. So those are the next steps, Madam Chair, and the board will be abreast as to once we complete finalizing and streamlining these processes. As I stated, Ms. Rowland will have a deadline to try to get this done before next week, and it will be presented to the board. Okay, so again, thank you, Ms. Rowland, great job, and very happy to hear, sometimes you just got to include the students in the decision-making process, and you will be pleasantly surprised. They will be harder on themselves. So thank you again. Now, board and Madam Chair, our next presentation will come from Mr. Griffin and Ms. Caitlin Disler, who is the coordinator for learning technologies. One of the things that we're looking to obtain is timely feedback as it relates to the cleanliness in our buildings. So as you may be aware, ABM has already developed this survey that was shared with our principals, but we also worked on one, and we felt that maybe integrating both, because they both had really good elements to it. So we thought about maybe integrating and using one survey that will capture timely feedback from our schools will be an important strategy moving forward to ensure that we're maintaining that level of standard that we expect to take place in our schools. So I will ask Mr. Griffin and Ms. Caitlin to present. I also want you to know that this was also shared with ABM and their team, and we have agreed to use one moving forward. So I would like your feedback on this survey, if you don't mind. Mr. Griffin and Ms. Caitlin, it's your turn.
Thank you, ma'am. Chair Wright, board members, Interim Superintendent Balgobin, I appreciate the time. So we've been hearing all summer the ABM conversation that is very important to our reopening plan and the safety of our students, teachers, and faculty and staff at these schools. So we already kind of have in place for the pest control ticket system and feedback a system that we thought would work well in this regard. And it's kind of a ticket slash database type of system to where we can really put eyes on, basically a database that shows everything in one Teams page. And it gives the ability for us to put alerting through emails from the person who opens the case, which would be the teacher. Maybe the principal gets an alert email, could be ABM if we want to do that. It could be somebody on Greg's team, which is coordinating that work. So what you're going to see today is kind of a demo of this system. And again, we use a similar system for the pest control tickets or survey system. It's kind of a combination of a back-end database repository and a front-end ticket system for the end user. So I want to kind of turn it over to Caitlin, and then we'll open it up for any questions at the end. And again, keep in mind, this is like a first scene demo, so we can actually make adjustments, with feedback that we learned today. And we had a call with Greg and ABM this morning and got a little bit of feedback and may have got some ideas for some tweaks already. So please feel free to give your feedback after you see the demo, and I will turn it over to Caitlin, the superstar behind the creation of this system, and let her do her thing.
Good morning. Thank you so much, Mr. Griffin. I greatly appreciate that. Thank you for the opportunity to share and demonstrate, as Mr. Griffin mentioned, an online cleanliness concern form. The intent of this is to help capture feedback and concerns related to the cleanliness of classrooms and school spaces. I would like to share the features of the form, including automation of tasks and notifications to assist in real-time feedback and reporting. First, I'd like to share that it's important for the form to be easily accessible. The form can be made a tile in vPortal for all staff, and this would make it easy for them to find and report concerns from the convenience of their classroom. This form can be accessed on a laptop, a mobile device, or even a cell phone. So you'll note here in this example, I have the form as a tile, and we could push this out to staff as well for easy access. When I click on the tile, the form will load, and this form has been created and configured to only allow those with Volusia County Schools credentials to access and submit the form. This will help us ensure validity in reporting. As the form opens, it will recognize the user and capture their name and email address to assist in follow-up. Additionally, to assist with reporting, we have provided the contractual requirements from ABM, including the frequency in which these cleanings would be occurring. We thought that this would be important to assist teachers when filling this out on what the level of expectation would be on a daily basis, a weekly basis, monthly, and additionally annually. As I make my way through the form, you'll notice it does mention that it will capture the name and the email address of the person completing the form. We did add a question to ask for who's documenting the concern in case someone is completing this form on behalf of someone else. For example, maybe an administrative secretary is completing it on behalf of a principal. So in this example, I will enter my name as the person who is sharing a concern that I've noticed in my classroom. It's very important for them to select their school site on which this concern is relevant. So in this example, I'm going to use DeBerry Elementary in our example, and I'll share a little bit more about what will be happening in the background upon submission of this form. The teacher or staff member is then prompted to share their building number and their room number. There are a series of concerns that they can select from related to their submission. So for example, maybe in my classroom, I'm concerned with the restroom was not cleaned and the trash was not emptied. I can select one or multiple concerns from this list, and I also have the option to select other in case my concern is not listed. Additionally, I can provide other details related to my concern or other information that might be relevant. Once I'm done, I can click Submit. Once I hit Submit, there's a series of tasks that will take place in the background. An email will automatically be sent to the staff member who completed the form, and it will also send a copy of that email to the designated contact at the school site. This person can be identified by the school principal, and they would get copied on each submission for that site. Additionally, members of ABM and Mr. Aiken's team will be copied on each email submission. In this example, I have included Mr. Cologne as a designated contact for the example of DeBerry Elementary. Additionally, an Excel sheet is collecting all data related to the concerns, and this data can be reviewed frequently to identify trends and build dashboards if desired. So let's take a look at the notifications and the data collection of the example that I created. I'm going to open my email, and you'll see that I have an email. I'll pull it up. That has copied some of the information that we just discussed. So in this email, it copies the name of the person who completed it. It shows what site they're at, including the building and room number, anything that they selected from the options, in addition to an overview of the concerns. You'll notice in this example, I completed it, so I received it, and then Mr. Cologne, in this example, I had him as our designated contact from DeBerry Elementary. He also will receive that email communication. And in this example, I also included Mr. Clark from ABM. We have many options available on who we can include in these email notifications, dependent on which site is selected, and those that would need to be included for Mr. Aiken's team and the ABM team. I wanted to share one other feature. In this example, I also have the Excel sheet that is collecting information related to each submission that has been made. So you'll notice that this example that I have here has time stamped that I made this submission at 11:58 on August 11th. I was the person who submitted it on behalf of DeBerry Elementary, in addition to the building and room number. And this will help with aggregating data related to trends. So we would be able to identify which schools are reporting more frequently, and then we can also determine which concerns are being reported most frequently. So you'll see in this example, I've done quite a few tests to test out the form. So I wanted to share that as an example on how that data could be collected. I did want to turn it back over to Mr. Griffin, or if I could help answer any additional questions related to the form, but that would be an example of a demonstration on the ease of use. Again, noting that it would be very important for this form to be made available in the portal, an easy way for teachers to access, document their concern, and then those concerns would be shared in real time.
Thank you, Caitlin. I will turn it over to Chair Wright for any questions for any board members or Dr. Balgobin.
Thank you, Clint. Thank you, Caitlin. I'll start with Mr. Cologne, and I'll work my way back around.
That is amazing, and I think that that will definitely help us to be able to capture our issues. Everybody froze up on me, but I guess you guys can hear me because I can hear myself somewhere else. I will say that I know a lot of teachers have said, oh boy, this is one more task. However, I look forward to looking at these reports and seeing exactly where we are as far as the cleanliness of our schools and all of the things that folks are reporting. So again, and I don't, Dr. Balgobin, I don't know if you'll consider adding us to the distribution. At least I'll speak to Ruben. As a recipient for my district, even if it's just for the first few weeks, just to keep a pulse on what is being reported at our schools and what may need to be looked at, not to necessarily ever address them other than through you. So if that's possible, I'd appreciate that. And yes, I did get the email. So thank you.
Thank you, Mr. Cologne. Mr. Persis?
Thank you, Madam Chair. Caitlin, super job. How long did it take you to do all this?
Thank you so much, Mr. Persis. Not too long. I had a few of the pieces built out from a former project, and it's really exciting on the things that you can build out and develop, and a lot of customization. So thank you so much. And I think it'll be very helpful. That real-time feedback makes a big difference for all involved. So thank you very much.
Yeah, and so when the teacher does that, is the date automatically just put on there?
Yes, sir. The date will be documented in the Excel sheet. And in addition to that, it also becomes the subject of the email. So it will also note the time and date in which it was completed.
Great, thank you. That's all I have, Madam Chair.
Thank you. Ms. Cuthbert?
My one question is, how soon can we get it into everybody's hands?
We can have it probably ready tomorrow, I would think. And I don't want to speak at, at a term with Caitlin, but as long as everybody is good with the format and the questions and we don't have to make any adjustments, I believe we're pretty much ready.
Is there like a feedback? Can they contact you if, as our users use it, and they go, there's one question that I have found that I might like to ask all the time. So is there feedback that we can change the form later? Or maybe there's an issue that they're finding that it's not listed?
Yes, ma'am. Ms. Cuthbert, we can definitely include that as part of the reply within the email for any further modifications or feedback. That we can always keep it a very fluid process. As maybe new concerns arise, we can include that as well within the documentation.
Okay, is there a way our employees can add a picture? Because I received a picture of a Creekside Middle School toilet and roach this morning. So is there a way that they can make an attachment or insert a file?
Yes, ma'am. There's a few ways that that can be accomplished. Initially, I did have that as a question within the form. I do know sometimes, dependent on the person who's submitting it, we also don't want to cause frustration for them and making sure they can upload it. So we can definitely go back to the drawing board and see the best way to do that, whether that's through the email communication or in the form itself, but that is an option that is available. So we'll make sure that we test that more thoroughly to make sure that we can provide that option for our staff.
Okay, I'm anxious to get this form out. So if that's something you can do in the future, to work on that while this form is out there, this is great. It looks wonderful. The only thing it lacks is music in the background and, a little bit of, icons sprinkled around, or else, there's I guess some kind of an announcement that, yes, you did it right, or thank you so much, or this too shall pass, or something like that. So that's the only thing that's lacking, but otherwise extremely creative. Thank you, Caitlin. Thank you, Madam Chair.
Thank you.
You're welcome. Ms. Haynes?
Thank you, Caitlin. I love the form, but I also want to address, I did have some teachers reach out to me, and there was a concern where they said, I like our day porter custodian and he or she works really hard. I don't necessarily want to fill out a form, and there be like retaliation against our day porter when really it's our night custodians that are not doing the job. So, I like the layout of the form. I like the simplicity, but the truth of the matter is we need people to report, and I need them to report and report honestly. So I don't know if we need to have some type of piece in there where they can identify that this is an issue that happens during the daytime or this is an issue that happens during the evening, just because we have different employees working during the daytime or evening. And I don't know how my colleagues feel about that, but I want them to be honest and I want them to report. But I also want to make sure that when the work is not being accomplished, that we're identifying who's not accomplishing the work, because that was just one of the concerns that was shared with me. And I want to identify the right individuals, and I do appreciate all the work you've done. I personally would like to be attached, if at all possible, especially at the beginning, if Dr. Balgobin doesn't mind, to any of the reports that are coming in from any of the teachers or staff at the schools that are in my area, so that I too can follow. I'll follow up with Dr. Balgobin, but I've been out walking campuses with ABM staff, even last week and this week, just trying to make sure that things are where they need to be. And I can honestly say, in the 34 years I've been in Volusia County, there is no perfect. If you come to my house right now, I can tell you there's an area that needs to be dusted. And Mr. Clone is agreeing with me.
My wife has dusted all of the tops, so I don't want that to go out wrong, and then
Okay.
I don't have a home to go to because of your assertion.
So, but I have some top areas in my house that need to be dusted right now that have not been dusted, just because I've been out on school campuses. but there's never going to be, there is no such thing as 100% perfect. I don't think any one of us live in a home that is 100% perfect, that there isn't something that could be cleaned at any given moment, unless maybe you are my mother who cleans every day. But with that being said, I do thank you, Clint and Caitlin, for all of your work on this. And I don't know if maybe we could just add a piece for if this is our daytime or evening employees, because people were concerned about having their daytime employees who are working very hard, and there's usually a limited number of them, have repercussions for them when it's the nighttime employees not following through on the jobs. So that's the feedback I have. Thank you.
Thank you, Ms. Haynes. I too agree, and my question was the same thing Ms. Cuthbert asked. I would like where if someone would like to upload a photo, if not now, I too agree that we need to get this out as quickly as possible, but if we can eventually have something where they can upload, that'll be good. And I'm interested in the data for the first couple of weeks as well. Thank you, madam. Anything else, colleagues? Go right ahead.
Can we too, as we tour our campuses and we see something, can we report as well? I mean, we can open it up and just say who we are and what school we're at. We can do that as well.
Yeah, it should be
Yes, ma'am.
available. It should be available in the portal, and I'll let Caitlin kind of add to that.
That's
Yes,
great.
ma'am.
Thank you. That's
You would
wonderful.
be able to complete it as a Volusia County employee, and then dependent on who the designated contact is at that site, they would also receive that notification as well.
Okay. Thank you so much. Thank you, Caitlin. Thank you, Mr. Griffin.
I think that is all of our questions, Mr. Griffin and
Madam
Caitlin.
Chair,
Go
I have
ahead,
one quick question. So Caitlin, I know you are super awesome, and is there a platform where this can be done on a cell phone?
Yes, sir. This form actually can be completed from a mobile device, whether it's your laptop, an iPad, or a cell phone. The form actually lives on the web, so you can complete it from any device.
You're awesome. Thank you.
Thank you.
I think we're both on mute. Thank you, Dr. Balgobin. Back over to you.
Thank you, Madam Chair. Thank you, Board, for your very insightful feedback. We will make notes of that. And yes, Ms. Disler is a little superstar in the learning technology department. So I want to thank her and Mr. Griffin for really jumping on the bandwagon and becoming part of a more of solution-oriented team, because we have to find a way, right? So I think this is a path in a good direction moving forward. And one of the things we wanted to make sure that it's not a cumbersome process for the teachers, that it would not take more than 60 seconds to complete if needed. I did not share this with the school because out of our respect for this board, I wanted you, each and every one of you, to be able to see this and provide your input before we roll it out. So at this point, what we will do, we will identify that delivery chain for this, which would be a school-based staff, that whoever the employee is that fills it out. There will be an administrator on that campus, each campus, that will be able to see all of these for recording purposes and following up and following through. There will be an individual at the district level also that will be assigned to this. And then, as you have requested, school board members, you will be a part of it also for the first few weeks, unless you get to a point that you would not want to receive the notifications. But it will be in those biweekly meetings that we're having with ABM, it's data that we will be capturing to have those conversations as we move forward. So thank you very much again for your input. And now we will roll it out tomorrow. Now that you have provided your input, we will make those adjustments and roll them out. So last but not least, I would like to ask Mr. Mark West, and I know Ms. Rachel Hazel is probably on the team as well, to provide us with an update in terms of the reopening and some of the steps, action steps that our HR department has taken. And any questions that you have, any recommendations, we would like to hear from you.
Thank you, Dr. Balgobin. Good afternoon, Chairperson Wright and board members. Thank you for this opportunity to come before you to talk a little bit about leave and the hiring updates that we have for our employees. And Aaron has a PowerPoint that we're going to go through real quickly. We've sent out a number of surveys to our, you can go to the next slide, Aaron, to our sites to gather information. And of course, we're also tracking a number of this information in human resources as well. So by sending those surveys out to the sites, we want to get the most accurate information. Up to this point, we have 35 employees who have requested the Families First Coronavirus Response Act leave, which of course allows them the opportunity of up to 80 hours of leave that is paid for by the district in regard specifically to COVID-19. We have 56 employees who have requested extended leave beyond that and have started at the school site for that. Next slide. We've been tracking our resignations and our retirements actually since June, and we have 113 who have retired, and we have 187 of those resignations. 128 of those are for personal reasons. 38 are for education elsewhere in Florida, 12 are for employment outside of education, and 9 are for education outside of Florida. So we've been tracking what kind of resignations we have accrued as well. Next slide, please. And now we're kind of up to where we are as far as vacancies are concerned. And remember, we put that hiring freeze on at the end of our transfer period to kind of put a holding pattern on to determine where things are going to land. And we currently have 128 instructional vacancies. While we have hired 190 employees, we still have those 128 vacancies, but we're holding them right now, looking to see and having conversations with principals on actually adjusting their schedules to fill in where needed for those vacancies. I'm going to hit one more, next slide, please. We're going to talk about support vacancies quickly. That we have 122 support vacancies as well, and have hired 78 of those in support as well. But on the next slide, I wanted to show you that we actually have been working to recruit our substitutes. Currently, we have 2,742 substitutes who have gone through the STAR training, who are eligible to sub. And we are also opening up our sub training over the next 3 weeks. We have 140, I think, who have been scheduled to go through the training up with this upcoming week as well. So we're going to be adding to that number, recognizing the fact that we might have to have some of our subs. We have also made the commitment to have those subs trained on our reopening plan, those who are going to be long-term subs. And they will actually be able to participate in that pre-planning training, a week of that as well. That will get them through the mandatory required 35 hours of training for that as well. In addition to that, we are anticipating if there are any administrative coverages that we have to provide for. We've identified 35 current administrators at the district office who are eligible and have been principals, and will be eligible to cover for any administrators that would have to go out on any sort of temporary leave for either FFCRA or any kind of COVID-related sending home. So that is the update from HR and what we've been doing to anticipate some of the things that we have coming up. As far as Volusia Online, you are aware of those numbers, and that Ms. Peterson had her first day of pre-planning today and has invited those teachers in. We've had a number of teachers who have been taken from our school sites, and we recognize that, and there's going to be some shuffling along there, but we're very excited about what we're providing through the enhanced Volusia Online. So that's my report, and thank you so much, everybody, for giving me the opportunity to discuss that.
Thank you, Mr. West and Dr.
Yes, ma'am.
Balgobin. I'll start with you, Mr. Cologne.
So, Mr. West, thank you so much for this information. I guess my biggest concern, and the superintendent can speak to it, how far along are we? I know our counselors are just getting back today, and we have a lot of different scenarios as it relates to Volusia Online students who want to go to school, who only want to do a couple of classes and all that. How are we looking from an HR standpoint in getting all of those allocations and everything sorted out as it relates to Volusia Online?
So we've been meeting with principals on a fairly regular basis, very regular basis, 2 and 3 times a week to have conversations regarding this. And we've been tracking the numbers. Of course, as you know, our enhanced Volusia Online numbers and enrollment actually closed last week. So we were able to solidify those numbers and get those to our principals so they could drill down and actually know the individual kids who are actually going to be leaving their schools and going to Volusia Online. We also had our principals reach out to those students to make sure that that was going to be their choice and that was going to be kind of the commitment that they were taking for that semester, because we recognize that they have to actually fulfill the obligation of Volusia Online for the entire semester. And so once they commit to that, they need to do that. We do have some part-time students as well who will be, just as we always have in Volusia Online, and have identified those as well. So what the focus for the principals right now over these next 3 weeks is to identify those students who will be brick and mortar, who have identified themselves as brick and mortar and Volusia Live students, because they really are their kids that will be reporting, whether they're going to be reporting on an everyday basis or whether they're going to be coming in and going out, taking advantage of the Volusia Live program. Those are the kids that are going to be responsible for basically scheduling and make sure those are scheduled appropriately. So that's what they're focusing on. This week, I know they actually have those numbers and are starting to work those and break those down. And we have, like I said, 3 weeks to be able to focus and get those kids in classes.
Great. And so I've shared these concerns with Dr. Balgobin, and I'll share it with my colleagues here. I think my biggest concern is that Volusia Online will not be ready to go on August 31st because it's just a lot. I mean, they went from 140 students to almost 11,000. And so I think that's probably a vulnerability we'll have to look closely at. One of the advantages to Volusia Online is that unlike brick and mortar classes that are graded on by the attendance by minutes, online classes are based on completion. And so if students say the first week were not ready to go, I don't know if that's something we have to submit to the state just for Volusia Online, or if we're not ready yet. And so that's my biggest concern, and I think it's something we'll just have to keep our finger on the pulse to ensure that that we're ready to go in a good what's going to be a good experience for all students, as I've experienced in my own family. So thank you. That's my biggest concern.
Mr. Cologne, just to follow up on that 1 second, if you don't mind, I will say that we've been working with Ms. Peterson and in getting her folks staffed. We actually have offered administrative support as well. One of the administrators in HR is actually is dedicated to working with her, and since she has the expertise in the elementary level, she's actually working with those elementary teachers during pre-planning, and where Dr. Peterson is working with those secondary, and we have a lot of support that we're providing because we do recognize that enhanced Volusia Online is going to be very important for our students. So we are committed to make sure that we're ready to go on August 31st.
And may I add quickly to that as well? One of the discussions we also had yesterday, we understand that for these students now, 9,100, I believe that we have so far, it would be imperative that they get that customization because we're going to a different learning modality, right? So one of the things that we talked about yesterday is ensuring that we have enough guidance counselors with Volusia Online to ensure that they each have a caseload where they're checking in with those students and also monitoring, communicating with the families, and ensuring that these students will be successful. And if they're noticing a pattern or a trend where students are not being successful and they have intervened, maybe we need to look at a discussion for perhaps a different learning modality. So I think it would be really, really important that we have enough guidance counselors with their caseload clearly defined, and that we're monitoring that process as well, because the students will equally need that level of support. And we're working on that.
And Dr. Balgobin, I'm coming to you, Mr. Persis. So do we believe that there's going to be an issue with Volusia Virtual going live on the 31st?
No, ma'am. For
Okay.
Volusia Live, or our innovative model,
Not Volusia Live, Volusia Online. I'm sorry.
our priority right now, I'm so sorry, I don't know what it is. Our priority right now is to ensure that they are ready to go. So if we have to do 2 or 3 meetings per week, as I stated on Monday, we had an additional administrator added to the team so that we can break down the caseload, and Ms. Peterson can focus on secondary, and that individual will be assisting, and they have experience with the elementary. The next steps, a data analyst, we discussed a data analyst, adding a data analyst to ensure the registrations are taking place, and that we're going to be tracking that on a weekly basis. And also we're going to be adding some guidance counselors. So Enhanced Volusia Online is a priority right now, and I have 3 individuals on the team that's periodically checking in on a weekly basis so that we are ready. There is no option not to be ready. We must be ready.
Persis?
Thank you, Madam Chair. I like that, Dr. Balgobin. No option. You got to be ready, and I'm sure we will be. Glad to hear from Mr. West that we're giving all the support that we can to Susie Peterson. Susie, you must be going crazy right about now, but hang in there. The cavalry's coming, I'm sure. So my question would be, does she have the certifications of the teachers to match the needs of the students who have enrolled in the Enhanced Online?
Yes, sir. And just to comment on that, some of the support that we've been able to Dr. Peterson with this, and she's been working with all of the assistant superintendents, but also Stephanie Workman has been working with her, because we basically had to create a master schedule, which is something that we haven't normally had to do for Volusia Online. So Stephanie has been working with Dr. Peterson very closely to create that master schedule that provides all of the support that we need for each of the grade levels, first of all, elementary, middle, and high school in each subject area. And we've actually been able to hire those certified specific teachers for each of those areas. So part of what we sat down with Stephanie and Susie to do, and when I say we, the HR team, to look at the certifications of those folks who applied and been able to match up with the certifications, what those areas and needs were. So, and we also, by the way, ESC as well, that's been a big issue because we have we had over 1,000 students, ESC students, that were actually enrolled as well. And so we've been able to identify those ESC certified folks and make sure that they're in there as well. Yes, sir.
Yeah, that was going to be my next question. And when you say ESC, does that include gifted students as well?
Yes, it does. Yes, sir.
My other question would be teachers who would like to, let's say the teachers who are still on the fence about, coming back and Volusia Live or Volusia Virtual, just, and we have a few that are like that still out there, probably more than a few. Would they be able to transfer, like if I'm right now scheduled for brick and mortar, come back and, would they be allowed to apply for a vacancy, one of the 128, or would they be prohibited from leaving what their current assignment is?
So I will say that when we actually allocated those units to virtual Volusia, online, we opened up all of those to our current employees. So we opened it up to everybody in our district to apply for those positions. There was an application process which included a video involved with that as well that went to Dr. Peterson. She has been meticulously going through those. There are still some vacancies out there that she is hiring for. So I think there are still some opportunities for folks who are interested to do that. But I will say those opportunities are closing pretty quickly. And there are only a limited number, of course, that we do have, but they have been available to our employees first. Yes, sir.
Okay, that's comforting. I think what would not probably bode well at this point would be if teachers learned that they were prohibited from applying for a vacancy, and someone else new to the district got a job that they would really want. And now I understand our past practices have always been, teachers cannot transfer to a different school after a certain deadline in August, maybe August 1st, let's just say. A teacher couldn't transfer. But of course, the situations were different way back then than they are now. So I'm grateful to hear that we're giving teachers every opportunity to get to where they feel would be the best fit for them, given the unprecedented circumstances we're facing this year. Thank you. And the last thing about the 128 vacancies, so would that include virtual online as well as brick and mortar and Volusia Live? Is that a combination?
The 128, oh yes, no, they're actually at the school sites. That includes all of the vacancies that we have in the entire district. Yes, it involves all three. I'm sorry to answer your question. Yes, that involves all three.
It does involve
Correct.
all three.
Yes.
And are those being advertised now, or are we still on a freeze?
We're still on a freeze, but we've identified what the vacancies are. So here's what's going to happen over, as I said, the next 3 weeks, is that some of those are going to shift based on the number of students that we have at the school sites.
Sure.
So what we're really looking at are the kids who are selecting option 1 and 2, and considering those are the ones that belong to that particular school site. Yeah. And we'll base the numbers and make any adjustments based on those.
Got it. Thank you so much. Thank you, Madam Chair.
Mr. Persis, Mrs. Cuthbert. But before you move on, I have a question for Mr. West. So Mr. West, Mr. Persis thought about something. So when and then I want to give big kudos out to Stephanie, because I know my other high school, hopefully they have all of their scheduling done, because she's definitely the scheduling guru. That was one reason why we brought her as back from being a principal, which she was excellent. And I'm sure she probably misses her children, but she's really good. So as your group and Stephanie are going through this process, have we included, especially children that were from our Title I schools? So have we included that group? I believe Mrs. Cervenak and what's her name? And
Dr. Mundo? Dr. Raimondo?
No. Because Mrs. Cervenak, I thought was going to be with our, not,
She is with our transformational schools, yes.
right, transfer. So have you engaged that team? So that would be Cervenak and Gail Walden.
They have been involved with Ms. Workman on that, and
Okay.
Ms. Workman has actually informed me that the elementary kids will be actually scheduled by the end of the week. So specifically for that, I'm not sure. I can check with Ms. Cervenak and Ms. Walden to find
Okay.
out their involvement with that. All the assistant superintendents and their directors have been involved in assisting with helping Dr. Peterson, because we recognize this is just a monumental task that we're asking her to kind of undertake in a very short period of time. So we've all kind of jumped on board and helped out any way we possibly can.
Okay, because I am a
So,
little
yes.
concerned about those students from those 7 schools. I'm just making sure that they are being serviced, because we were actually looking at doing something a little different. And I believe if we're going to lose some of those students to Volusia Live or Volusia Virtual, we really need to be tracking the students from those 7 elementary schools.
Those schools.
Okay, thank you.
Yes, ma'am.
Hello, Mr. West.
Hey, Ms.
I appreciate the risk some of our Volusia County teachers are taking to go to a whole new platform. And it's a little scary. And it's also scary for the teachers who are left behind at their schools, because they see teachers have resigned or leave of absence or have gone to Volusia Online. And what assurance can we give the faculties who are left? I guess the principals have been notified that you all are working on restaffing those vacancies, but I've had several teachers contact me about the loss of faculty, and they are concerned. So what we as board members can do is say, just hold tight, things are going to level out. We're looking at the number of students and also analyzing the vacancies, that there is a freeze, but yet there's not a freeze. Correct?
Well,
so reassessment.
There's a freeze on outside hiring, because we do want to make sure that we're protecting our teachers that we currently have. So what we'll do is we'll follow our normal process of adjustment, fall adjustment. We'll, even though we're looking over the next 3 weeks at where our students have, filled out the surveys to see where they land, what we'll actually do is we're going to have to follow the same process we always have to see where students actually show up the very first day. And we have a 9-day count that we actually take, and that is kind of our hard and fast rule, I'm going to say, of what we've done in the past, because that way we can compare it to previous years as well and see what the trends are. And then at that 9-day count, that's when we make the adjustment, and we kind of say, this is how many kids we have at each one of the schools all over the entire district, and see what the trends have been in the past. And Deb Muller's team and my team work together to actually determine where those vacancies are, in addition to whether we have gains or losses based on the number of students who have shown up. So we have that same process in place, and that's something that's been in the collective bargaining agreement as well, that we follow each year, and we will follow that as well.
Okay, thank you.
Yes,
and my last question is, do we have student interns this year, and are they being still paired and with teachers and in this very difficult time?
Yes, thank you for bringing that up, and I'm sorry that I've been just so focused on our own employees and making sure that we're taking care of our own employees, and that is very important. But we also do have that opportunity and the potential for some of our interns that are becoming in, our first and second year interns, that Ms. Mahaney has actually just sent out an email to the principals today, verifying that we will have interns. Interestingly, some of them are going to be actually working with our enhanced Volusia Online. So they'll be using that platform as well and learning through that as well. So I think this is going to be a very valuable lesson for them. We'll have all 3 modalities that they will be able to work with and learn from. So I'm very excited about that as well.
Okay.
Yes,
Thank you very much, Mr. West.
Thank you.
Thank you, Madam Chair.
Yes, and I must say I met about 10 or 15 from Bethune on last Friday that are all planning to intern this semester. So some of them are banned, but I'm sure that they're equally happy. I told them to make sure that they learn all three modalities because they never know where. I just see public education stand where we are now. Ms. Haynes, I'm turning it over to you.
Thank you, Mrs. Wright. So, Dr. Balgobin and Mr. West, I actually have several things that I'd like to cover, if you don't mind. I'd like to start with the first slide that we looked at, where it said 35 employees have requested currently the 80 hours of leave that the district is paying for. So after receiving a lot of emails and seeing that there appears to still be a lot of confusion about this, I want it to be very clear because I've had community members even reach out to me about this. So the 80 hours of leave that fall under the FFCRA leave, that is 80 hours, which equates to 10 8-hour days of leave that any employee can access if they are tested positive for COVID or they've been in a situation where they've come into contact with it, and that is not part of their own leave that they earn, correct?
That is correct. Yes, ma'am.
Okay. Yes, go ahead.
I was going to say, just to follow up on that, we've actually put on the website a link to that shows the employees what their actual rights are under FFCRA. And because I know there's been a lot of conversation, Ms. Haynes, regarding this, and it's up to 2 weeks, approximately 80 hours. It says a 2-week equivalent of paid sick leave that is paid by the employer, that's paid by us. And for the reasons as follows, and it said is subject to federal, state, or local quarantine or isolation order related to COVID-19, has been advised by a healthcare provider to self-quarantine. So that means if Ms. Fisher, if we send somebody home because of the quarantine based on our protocols that we have set up, then that's what that FFCR leave is for. So yes, ma'am.
Thank you. Because as I said, there's confusion out there about that leave, and there are people that seem to still not understanding that that leave is available if you meet the criteria and that we are paying for that. It's not coming from some magic pot of funding. The next thing I'd like to talk about is our substitutes. And so when you showed us that we currently have the 2,742 available, I know that I've had some substitutes reach out to me and I have forwarded those emails on. Some have given some great suggestions or solutions because they are willing and able and want to come back in to sub. They just want to understand the safety protocols and all of that. And so have we yet determined out of the available, the 2,742, the number that are willing to come back in yet to sub, or are we still working on that?
Actually, we're still working on that. We actually have that, and I'm going to be frank with you, it's kind of one of those things where we put out the survey, but what we're doing now is making it more targeted, where we're actually sending our emails, we're looking to send emails to those individual subs to make sure that they are all, like you said, interested in coming back and where they're interested in going. I visited 3 schools this morning, and because of course, I'm going to always ask the questions, you know, how many folks do you have on leave? How many folks did you have transferred to VOL? And how many vacancies did you have? So basically, how many spots do you have right now that's open? And the schools, the principals of the schools that I ask about that, of the 3, 2 of them said that they did have vacancies. 1 had no vacancies, which I was thrilled about. But the 2 schools that did have vacancies, either from leaves or VOL leavings or just because they had vacancies prior to, all had their, I'm going to call homegrown subs that they were thinking and anticipating already that they would be able to bring in and have help cover those vacancies until we can actually get through that 9-day adjustment period. Now, not every school is that proactive or maybe has that opportunity. I understand that. But that's part of what we're working on with the principals is to start identifying those that can fill in for the vacancies as well. So we're doing that kind of as twofold. First of all, as district, and also as the school sites as well.
Okay, thank you for that. My further follow-up on that substitute piece, as we identify who these substitutes are, and or if we're already possibly lining them up, because I know that we could have a teacher, you know, that is planning on going out on maternity leave or someone having surgery, and typically they're always in the process of lining up their substitute. I'd like to know how we're going to communicate with the substitutes, what the safety protocols are for our campuses, so that we can make sure that they know when they're walking in what the expectation is, you know, what will be available, the steps they should follow with students, so that we're all on the same page.
And that's a great question. And what we have anticipated is those substitutes who are going to be, we're going to call them long-term subs, for those subs for the vacancies. As I said, we're going to put them through the safety training, which is incorporated in our reopening plan during that 1 week of pre-planning. In regards to the training or the safety training for just going in, I'm going to call the day-to-day subs that do that. To be frank with you, we haven't set aside a specific time that we're asking them to be trained, but what we are looking to do over hopefully maybe the next 3 weeks is potentially have it's our safety training video. It's a 2-hour video that we can actually have them come in and view, just like we're having our teachers do right now. And that'll give them the opportunity to actually be at least on the safety precautions of what it is that we're facing here. So that's something that we're looking to do.
Okay. Moving on to the administrative coverage and the fact that there are 35 district staff that are available, because I'm assuming they've already been a principal or assistant principal or meet that criteria. Have those individuals been notified that they are on that list and that they are on standby to cover at schools in the event that we need them to step in to assist if an administrator is sick? I mean, to me, it's no different than, you know, I don't think there's ever a year that we don't have an administrator for one reason or another that has to be out. And so do those people know who they are?
First, I'm going to say yes, they've been identified and acknowledge that they have the qualifications to cover for those sites. I want to be careful because I want to check on that to make sure all 35 know. The expectation, though, and the reason that we actually created this list was for the fact that we recognize if we have a principal that's out in the past for a day or two, we would have the administrative staff, of course, would cover for them. But if we're talking about a principal that's going to be out for 2 full weeks, we recognize that could put a strain on the school. And the reason we created this list was we wanted to have it kind of on a rotating basis. So not any one person was going to be asked every time, you need to go to the school and fill in, or you need to go to school and fill in for a 2-week period. So I'm not going to say that all of them know, but we're in the process of notifying them to let them know. But good point. Thank you.
And to follow up with that, I think it's important that those 35 individuals that have already been identified also receive the same safety protocol training that you're putting all the other administrators and teachers through, because, you know, they may be sitting in a district department right now where they know, okay, like, here's what we're doing safety wise, but it's different when they walk onto a campus. And I personally, as a board member, since you said that there is a 2-hour video for the safety protocol, I'd like to know if that can be made available for us also, because I am willing to participate in that 2-hour training so that I also know what is happening on campuses. Because when I visit a campus, which I've already been out there visiting and assisting, I don't want to not know what is expected and therefore then not follow that and be setting a bad example for students or teachers. So if we could, I personally would like access. I'm not speaking for the rest of my colleagues. Then moving on to the Volusia Live. I know that the Volusia Live piece, there's still some ambiguity or some people that are confused about just kind of what that looks like. And so I would just like to talk through some points that I have about that and get clarification to see where we stand on it. I know that it's been discussed now that teachers in elementary, pre-K through fifth, that we're doing our best to have a designated live teacher. I still know, though, that in some instances that may not be possible. And Mr. Persis, with your permission, I'm going to talk about some of the tinier elementary schools that are in your area. So I know that Mr. Persis has Ortona, Ormond, and Osceola that are all very close in vicinity. And I know that Ortona is Mrs. Wright's, but they're all very close in vicinity, but they're also all very tiny schools. And, I had asked about what their Volusia Live numbers looked like. And I just, when you take Ortona, Osceola, and Ormond, I don't know that you can just say, all right, we can have a designated kindergarten, a first grade, a second grade, a third grade, a fourth grade, and a fifth grade teacher at all of those schools when you only even may have 200 kids total. Well, if 32 kids were all that selected Volusia Live, you can't have 6 dedicated teachers to teach that. So I have thought long and hard because I've taught those grade levels, and I know that we wanted to keep students attached. And I really would like for teachers to be able to give a little input on that. I'm speaking from a teacher standpoint, having taught those. And if you were going to designate me as the Volusia Live teacher, or I volunteered for it, if I'm at Ortona and say I'm a first grade teacher and I say, okay, I'm willing to do Volusia Live, but there are only 5 first grade students at Ortona that are going to be in Volusia Live. So you say, okay, Ms. Haynes, actually what we're going to do is we're going to have you do kindergarten, first, and second grade Volusia Live. I will tell you that is a difficult task to meet the needs of 3 different grade levels in a Volusia Live setting. I would prefer you have a conversation with me, and this is what happened this summer. And I've talked to teachers that taught summer. A teacher taught 4th grade summer, and they actually had students that were from Citrus Grove, Stark, and George Marks on their list that were all 4th graders, and they met their needs. And I'm just saying as a teacher, all right, I'll do 1st grade live, and I'll take the kids from Ortona, Osceola, and Ormond that are all in 1st grade live so that I'm at least teaching the students that are all getting the same standards at the same level, so that maybe I have to individualize. And so I don't know if we've had those kind of conversations yet, and if it's possible to have those conversations in situations where our numbers are low, because I know that we can't just afford the salary of a teacher to meet the needs of only 5 students. And so I would like for that to be considered, and for us to look
Definitely.
and talk to those teachers and talk to those administrators, and if possible, get creative. And I've looked at it from the side of a parent also. I, as a parent, would want somebody dedicated to know that they are doing the curriculum for my child where my child is, not trying to shuffle or handle 3 or 4 different grade levels in a live situation. And that's my thought on elementary. Now, moving on to middle and high, I know that there seems to still be some confusion out there, and I've heard a variety of responses from teachers about, well, administration and guidance, and my hat's off to Stephanie Workman. She is phenomenal, but it's kind of like, well, schedules have already been built. So if I'm the 7th grade math teacher, I still could have students sitting in front of me and students live. All right. I worked this weekend with a friend of mine who's a 6th grade math teacher in Lake County. She's going to do 3 periods face-to-face, 2 periods live, and then 1 period of intensive math. I still feel very strongly that if at all possible, we need to have face-to-face be face-to-face, live be live. My 7th grade math, sure, I'll do 4 periods face-to-face and 2 periods live. If we can make that happen, and even if we have to, work some extra hours to change some schedules. Now, I know where it may not work is like an IB class at the high school because it's offered 1 period a day. But typically our students that are in IB are very self-motivated. They are those go-getters and their parents are involved. So I don't see that as a big a deal. But if this is a multiple period a day course that we offer, I'd like to still see us make the commitment to do our best with face-to-face is one form of a period and live is another period, if at all possible. I would like us to look into that instead of just saying, nope, we're mixing, why mix 5 periods of that if we can do the other, if at all possible. So that's where I am on Volusia Live. Moving on to Volusia Online Learning. Mrs. Wright, I was going to put you on the spot for a moment, but then I decided to look up my own data. So we know for a fact we have over 9,100 and some students that are going to Volusia Online Learning full time. And we also have heard that there's a percentage going part-time. So I want to talk about 9,100 and some students for a moment. And I've been talking about it from the aspect of saying, so DeLand High is our largest high school with over 3,000 students. So that's like having 3 DeLand Highs. Or taking one of our largest elementary school, which goes back and forth between Citrus Grove and South Daytona, and that's like having 9 or 10 of our largest elementary school. But I want to just think for a moment in terms of our colleges and universities that are within Volusia County. Embry-Riddle last year reported their enrollment was at 6,613 students for 2019. Bethune-Cookman was 3,773. Stetson was 4,341. All 3 of those universities are smaller in the number of students than what our Volusia Online Learning site is this year. I appreciate the fact that we have already designated someone to assist her that was a former elementary principal with the elementary part. But I need to say this clearly. We need to make Volusia Online Learning today, not tomorrow, not next week, not in September, a priority. And we need to staff that program no differently than what we're staffing DeLand High, Citrus Grove, South Daytona. Think about the amount of staff that's on Bethune-Cookman's campus to service 3,773 students. She needs guidance counselors ASAP to do these schedules. She needs office staff. I have watched her answering parents on social media at all hours of the day and night. I don't know how she's still standing. And yes, we've been moving teachers over, but it needs to be a priority that she has her staff and she has the help she needs. If we have to take some people out of the district or off of school campuses where our numbers are lower at school campuses, this needs to be a top priority. And I'm going to apologize to her that I, as a board member, it took till today that I'm asking for you to make this a priority, even though last week I spoke up and she didn't ask me to, okay? But look at the sheer numbers. I want to know if anyone sitting here today thinks that they're capable of opening a virtual school with over 9,000 kids without a team to help you do it. I can't do it. I don't think any one of us could. And so we can't sit here and just look at the numbers and say, well, we'll get her this help, we'll hire more teachers. We need to put some dedicated people onto this, because if we're not successful here, those families are going to leave, and it's on us.
Agreed.
And so I don't think people understand the sheer numbers of what we're asking her to do. I mean, walk on any one of your high school campuses and tell me if there's one administrator there pulling it off on their own with, maybe 1 or 2 guidance counselors and a secretary. So I want her to have the help that she needs. Thank you.
Thank you.
Are you finished? Okay, praise the Lord. She normally she doesn't go off on a tangent, but she had her tangent today.
It wasn't me.
It was not you, because normally it's you. You're right. But I will say this, and I love my colleagues, but I don't know if I agree with you, Miss Haynes, on the Volusia Live, and I'll tell you why. Part of what we submitted to the state was that the students would remain at his or her school. And once we start commingling students from different schools, and say November, the children return to school, now they're not in a class with their classmates or students from his or her school. So I really do have some concerns about that. And I think we have to look at that. Again, that was what we got to be honest to what we said we were going to do. And that was one of the reasons for me even going about this class size amendment, to address that. We potentially somewhere we could potentially have really low numbers, and I would say more than 5. But in the same vein, we promised parents that their children would remain at their school. So when they return, they were with classmates or students from their school. And so that's my only concern about that one. I hear what you're saying. I just don't agree with that, because we should have created something a little differently if that was the way we were going to go. And that's the reason why we have Volusia Virtual. I mean, now we're moving almost to a Volusia Virtual model, calling it live, in theory. But go ahead. I see you want to hit me, but go ahead.
I don't want to hit you, but what I just want to say is I've taught everything but 4th grade and elementary. And I am just telling you that any year we've ever even asked a teacher to, like in brick and mortar, to co-teach a 2nd and 3rd grade combo class, somebody loses out. You know, when you are a teacher and you're trying to deliver the standards, even if it's your top 2nd graders, you know, that have been put in your room with 3rd graders that are usually like on an average is what they'll do, and they'll go, well, they kind of are working on the same level. You still have to deliver those standards to those kids at where they're at. And as a teacher, to teach live and deliver standards of more than one grade, because if I'm at Ortona and they're like, well, Jamie, you got 3 kindergartners that are live and 4 first graders that are live and 2 second graders that are live, to give me enough, that's almost an impossible task to do. And that's why I was just saying it, because I talked to teachers that this summer, say, did 4th grade, you know, math or 4th grade reading, and they did it virtually, kind of in a live setting where they taught live lessons. Mm-hmm. And I said they had kids from numerous schools in 4th grade so that they were teaching the same standards. And there's no perfect answer on that. It's just when we backed off and said that we would guarantee, because that's what I heard happened in bargaining, a dedicated teacher pre-K through 5th. Because first we were saying pre-K through 2nd, okay? And those little guys, you know, it's really hard to mix and try to hold a kindergartner's attention and a 1st grader or 2nd grader's attention at the same time when you're delivering different instruction. But when we backed off also and said 3rd, 4th, and 5th, I said this is going to be a problem with numbers, because really, what if we have a school that only has 3 3rd graders on live? Can we afford to pay a teacher's salary to only address? And I hear you, Mrs. Wright. I'm just looking at how, because it's different to teach Algebra 2 or Algebra 2 honors, or teach 7th grade math or 8th grade science. You know, it's different. I could maybe pull off a 7th and 8th grade science, although I'm not saying to do that, okay? But like, you have a period that you're teaching. But when you're teaching elementary, you're teaching every subject all day long. And if you have to teach every subject all day long to kids in different grade levels, that's a big task.
Wasn't recommending that either. I was just saying I'd rather for us to really look at the numbers, let the principals get back with Dr. Balgobin before we make any hard decisions on those types of decisions, because again, I want us to stick to what we submitted. And I believe we can figure it out, and not saying that we can't do it that way, because we may have really small numbers. But again, I would rather wait and let's look at what schools will be impacted the most, or if any school. But I think we should first get our numbers. That's all I'm saying. Mr. West, the two questions I had were asked, so I won't go back over those questions again. Any other questions for Mr. West, colleagues? Okay, hearing none. Thank you, Mr. West.
Thank you.
Turning it back over to you, Dr. Balgobin. We're going to go to action item 3.01.
So before we go there, Madam Chair and Board, I just want to respond quickly and share with you where we are. Actually, yesterday I had our very first meeting with the cabinet members to really look, because the three options that we're providing, I want to make sure that we're monitoring and looking at those numbers on a weekly basis, but we're going to be looking at it through multiple lenses. So one of the directions that was given to the team, which we already have the spreadsheet that we've started, but we're adding more columns to it, is that for every school that we have in our district, all the schools will be listed, and it will show their numbers that they had in terms of capacity for last year, how many students they have each of those schools. Then to your right, we're going to have several columns. So for each of those schools, what are the numbers for option 1, which is the traditional setting? What are the numbers for Volusia Live, which is that fluid model, right, with the students at home? What are the numbers of students from that school that have opted the enhanced Volusia online? So we'll be able to see it right there next to each school. Then we will have unit allocations that's been given to each school, broken down by either grade level or subject area. Then we will have, in terms of Schoolway Cafe, free and reduced for each of those schools, what are the numbers? So we will know, because for the Volusia Live, we're looking to ensure that we can provide for those students and their families breakfast and lunch. Then we will have transportation, right? How many students will need transportation? So in one spreadsheet, we will be able to see a big picture of every one of our schools, all 67, based on these very important elements. But in addition to that, we will share that with our principals, because then we will look at those numbers, look at the unit allocation and what needs to be done. Mrs. Haynes, I'll tell you that we are going to be including our teachers in that decision-making process as we're looking into who will be teaching a dedicated class. If we don't have the full numbers, what might be a creative solution to that? And we will be addressing those on an individual basis. I will keep the board updated on that. But what we will be doing is that on a weekly basis, we'll be able to see our numbers for all 67 schools based on these three options and what's taking place in all the different areas: Schoolway Cafe, transportation, unit allocations, and so forth. So wanted to share that we started that work yesterday, and our principals will be involved in this, because we want to do the groundwork for them and then get them engaged and involved, and then we continue and trickle that all the way down to scheduling and who is going to be teaching what and so forth and so on. Second, I want to share this with you, Ms. Haynes. I know we've had several conversations regarding Volusia Online, and you know that I've convened meetings and taking actions. What I will say to the board, because you're absolutely right, 9,100 full-time students, that is a major load. I know that we have deployed a few staff members this week, but that's not sufficient. We will need more. So although I have teams that will be convening with Ms. Peterson at least 3 times a week, I will set up personally a meeting with Ms. Peterson once a week to ensure that follow-through is taking place. Okay, so just wanted to share that with you guys, and because I know it's a lot that's going on. All right, so now you're ready, Madam Chair, for 3.01?
Yes.
So, Madam Chair, in our July 28th meeting, you also requested in the board that we revisit our discussion of the approval of some waivers to submit to the state regarding class size numbers, funding, and so forth. So Mr. Pendley has worked. I am echoing really bad, so I apologize. I don't know why. Mr. Pendley has worked on those waivers, Madam Chair, and he's here to present to you and get your input, the input from the board.
Good afternoon, Madam Chair, members of the board. Going back to the July 28th board meeting, we were discussing a number of waivers. Madam Chair, you had recommended as to the class size, funding issues, and then I believe Ms. Haynes had also requested that we look into waivers concerning testing for this year. So based on the input from that board meeting, we went back and I discussed with our assistant superintendents at each of the levels, elementary, middle, and high, how we might address that, got some input from them. And what you have before you today is a recommended draft of a letter requesting waivers to the governor, Ron DeSantis, and to the Commissioner of Education, Richard Corcoran, in those specific areas. So what this waiver does, the letter requests flexibility for state funding for the operations of public schools in Volusia County during the 2020-2021 school year, and for a stay of high stakes testing enforcement due to the exigent circumstances of the COVID-19 pandemic. What we essentially are asking the Department of Education is to approve waivers that provide clear and consistent guidance for the operation of public schools this school year. If you'll look at the document there, and this is a draft, it is specifically for your input, and we can massage the language. What I would be seeking at the end of my presentation is a motion to allow the chair to work with us to finalize the language, but then to submit these waiver requests as soon as possible. The first waiver that you see, and we can also divide these up if that's the board's pleasure, into two separate waivers, but for our purposes today to workshop through the language, we can do it in one document. But the first is for a waiver of the full FTE funding for reduced class size. The concern there being that with the blended in-person and Volusia Live models, that we would have potentially a situation where full funding for FTE based on the average class size would fall below what would be sufficient to fund those teachers. And as you talked about with Mr. West earlier, those concerns and allocations of units at various schools, this would allow us, this waiver would allow for full funding through the entire school year. If you recall, going back to Commissioner Corcoran's July 7th emergency order, the hold harmless provisions of that essentially, as we read them, indicate that the Department of Education will continue to fund at full FTE based on the 2019-2020 school year numbers for the fall semester, but it doesn't guarantee you what the funding will be going into the spring. We've had conversations with the Chief Financial Officer, Ms. Muller, concerning what that might look like. And of course, no one is able to predict with any certainty what the Department of Education is likely to do come January, and certainly not into next year, based on legislative concerns and funding concerns. But what we're seeking is to maintain that, essentially, is to maintain the hold harmless of the emergency order through the spring 2021 semester. That is the sum and substance of what we talk about there with the class size averages and so forth in waiver A. Waiver B discusses the high stakes testing enforcement, and what the input from the assistant superintendents and principals at each level was no one is seeking a waiver from testing, from high stakes testing, because we need that data to inform decisions for students. However, and I believe going back to Ms. Haynes' comments from the July meeting, if we're going to a new testing system anyway, and that being the best model, it would make sense to have a waiver for high stakes testing this year that would allow us to then establish a baseline going into the new testing model and then use that going forward. And what I pointed out is that we realize here, because there was a statewide closure of the entire education system from March of 2020 through to present, we're likely to see students experience educational slides through no fault of their own. This system, the waiver would seek to have flexibility due to that disproportionate testing situation to allow us to establish the test this spring, in the spring of 2021, as a baseline going forward, and then have the school grades and so forth be based off of that come the 2021-2022 school year. So that is in substance the way I understood the request for waivers to fall. And of course, as I said, I'm willing and certainly welcoming of any drafts, any input into this draft. And if we need to make changes, we can do that on the fly. But the important thing today is to get board approval to seek these waivers in some form, at least in spirit, and to delegate that authority to the chair to sign off on if that is the board's pleasure. Thank you, Madam Chair.
Thank you, Mr. Penley. I'll start. Ms. Haynes?
Thank you. I'm in favor of both of the waivers because, you know, I've been concerned about the funding, and I would like to see some kind of guarantee that they would hold us at our funding for the entire year, which could allow us to have a reduced class size, not maybe in all instances, but in some areas, because there's nothing equal out at schools. But my number one concern has been to be able to continue to maintain our employees and not have to have a loss of employees like we did when we went into the recession time. And I still stand by, since we did not administer last year's assessments, because I don't mind having student data. I'm all about student data, knowing where are they at, are they making progress or not. But we, you know, the governor chose for us not to give the test last spring. And since we are moving to new standards, I want us to be held harmless at this time so that teachers can teach versus teaching how to take a test. So thank you, Chairman Wright.
Did you see any language, or is the language fine?
I believe the language is fine. There's some spacing, and we just need to check the specifics, but
the layout.
The layout.
Okay. Ms. Cuthbert?
Madam Chair, I believe Ms. Cuthbert is muted if not hearing her comments.
I'm sorry. I guess I took my eyes off the microphone before I went on to talk. Thank you. Thank you, Mr. Penley. I too am in favor of the waiver. It's very clear and to the point. Excuse me. And it's necessary in order to have a more harmonious and focused time in class for not only our students, but also our faculty and administration. And it's to hold our kids harmless for this, and also to create a baseline for testing. We have to be able to see, this is just a baseline, hold them harmless, then we see the growth. That used to be that way. Testing just wasn't right off the bat and you were tested. There had to be a baseline. And that was at the beginning of FCAT, a long time ago, in the early part of this century. So it would be lovely if we could do this. I think it's a really, really good idea. And we did narrow it down to these two. And the sincerity of it, I think, is well expressed. So thank you very much.
Thank you, Ms. Cuthbert. Mr. Persis?
Madam Chair, I also am in favor of both of the waivers and concur with the comments from my colleagues. Thank you, Madam Chair.
Thank you. Mr. Cologne?
And so I too am in favor. The only concern that I had was submitting one waiver versus two, because if they shoot down one, then we're going to end up with nothing. Where if we separate it as two different waivers, we'd be happy with 2 wins, but we'd at least have one, and we can massage the second. So that's my only comment.
Thank you, Mr. Cologne. I agree with Mr. Cologne, Attorney Penley. I would like to see them as 2 separate, if that's okay with my other colleagues, as 2 separate waivers. I prefer, if you're going to say one, no, decide which one. But I would like a win for both. But I'm like you, I just rather have 2 different waivers, if that's okay. Is that too much of a problem, Mr. Penley?
No, no, Madam Chair. I like the strategy. I welcome it. Thank you.
Okay. So we're all okay with the language as it stands, and okay. Yeah. Yes. So what we would need to do, is there a recommendation, Superintendent Bagabin?
Yes, Madam Chair, it is my recommendation for us to submit 2 waivers to the state, one funding, and the second would be the FSA waiver.
Dr. Balgobin, you're on mute.
You're on mute. She can tell me her recommendation, then we'll go. But thank you.
Sorry about that. I am unmuted now. Yes, Madam Chair, it is my recommendation that we submit 2 separate waivers to the state. One on the funding for our options of the Volusia Live, and the second would be for us to waive the FSA testing.
Thank you. We've heard the superintendent.
You're on mute.
Heard the superintendent's recommendation. I'll entertain a motion, and before we take a vote, we will answer our callers in the waiting room.
I'd like to make a motion that we submit 2 waivers to the state, one for the funding with the reduced class size and the other one for the testing.
Yeah,
Thank you.
Madam
Thank you.
Chair, I'd second that. I would just say that we need to give you the latitude to finalize any language with our attorney before submitting.
Okay.
Yep.
Thank you. We've heard the motion has been properly made by Mrs. Haynes, second by Mr. Persis. Yes, Ms. Cuthbert?
I noticed Dr. Fritz's name is on here as Superintendent of Schools. Is he aware of what's being said in his name? Is he aware? I just want to make sure, because I noticed yours is not on there. I just want to make sure. Okay.
I said it to Dr. Fritz.
Okay. All right. Thank you. Thank you, Madam Chair.
You're welcome. Okay, Mrs. Schultz, we'll take any callers for our action item.
Okay, we have Miss Christine Patterson is in the meeting.
Okay. Good afternoon, Ms. Patterson.
Hello, this is Christine Patterson. Can you hear me?
Yes, I can. Thank you, Ms. Patterson. You have 3 minutes to address the board. Go right ahead.
Great. First off, I want to thank you so much for being leaders in Florida and submitting these waivers, because I really think that it sets a precedent across the state for other school boards as well. So thank you all very, very much. I have looked over the waivers and I do have some questions.
Okay.
One of your waivers is for school grade calculation. That's the one for the FSA testing. And I'd propose that you waive the test itself along with any accountability measurements that punish our teachers and our students. I'd like to know why we're even testing and how state testing will happen. Will online students be forced to school for this testing? that kind of violates the choice to remain safe and stay home. I don't think we should be doing FSA for a measurement. The baseline is irrelevant. Bringing students into a building for possible exposure will not result in a valid result. And those that are actually there this year, I don't think the baseline will be valid either. In addition, state mandate under reopening requirements 1C mentions progress monitoring and tiered instruction. This is referencing the Florida MTSS/RTI requirements. These interventions are mandated to be research-based. This will be impossible in the current reopening plan, in the face-to-face option, in Volusia Live, and now from what I'm hearing on VOL, due to the staff being not really figured out or short-staffed, at least at this moment. Research-based strategy is impossible to implement in these platforms. Active learning and engagement will not be occurring in Volusia Live, as it is impossible for teachers to actively engage with two audiences in two different platforms. Students will be passively watching a teacher in front of the room, students in the classroom, and the teacher will be or should be distanced to prevent COVID spread and preserve health and community members, as this virus is communicable and we are all interconnected. I would like to know what the reopening plan states regarding progress monitoring. Will students be required to participate? What will the platform be? Why are we having it when research-based strategies as required by MTSS, RTI are impossible to implement? Will students be required to attend campus to participate? Most importantly, teachers are evaluated on their ability to engage students and use best practice. Will teachers be held harmless for their limitations of your reopening plan? Will students be held harmless for their grades due to the limitations of the options of the reopening plan? It is only fair if the school system be held harmless for the impact of COVID has on their school grade, that teachers, students, and families be held harmless as well. We will not be reopening to a research-based learning environment. All accountability measurements should be examined for feasibility. I propose any current mandate or accountability measurement from prior years that will punish those in our new environment.
Thank you. Excuse me. Thank you. I'll give you 1 second to finish your last sentence.
Sure. Be removed for the 2021 school year.
Thank you so much.
Thank you.
Mrs. Schultz, do we have another caller?
We have no other callers at this time.
Okay, thank you. Go right ahead, Ms. Cuthbert.
May I comment on the caller?
Sure.
Okay. This is an issue that I do know that our state legislature or our governor has said that we will progress monitor and there will be testing coming up. Is this something that an issue that we can give to our lobbyists? So as our state legislation comes up again shortly after the new year, that this issue that Ms. Patterson has brought up can be identified.
Yes, and we can talk with Dr. Vagabond about that and get them on the phone. Yes. Okay. So we have a motion on the floor. Go ahead, Mr. Colon.
And I just want to say that that is the spirit of these waivers, because we agree that this year is unlike any other year, and this is why we're doing it. So I just wanted to add that. Thank you.
Thank you so much. Any other comments? Hearing none, I'll call for the vote. Mr. Ruben Colon.
Yay.
Mrs. Jamie Haynes.
Yay.
Mr. Carl Persis.
Yay.
Ms. Linda Cuthbert.
Yes.
And Ida Wright. Yay. The vote is unanimous. Thank you, colleagues. Thank you so much. So we're down to our last item for adjournment. I'll start with you, Mr. Colon. Any closing comments?
Absolutely not. I look forward to visiting all my schools and meeting all our teachers as they're back. Yes, ma'am. I'm done. That was quick, right?
Mr. Carl Persis.
Madam Chair, I do have a few questions.
Okay.
If I can just go ahead, and these are just questions that have come into me. So extended day, social distancing, that whole issue, do we have a response? I mean, or can we give a response out to teachers who are concerned about, I guess I'm getting it both ways. How come teachers can't have their children in the classrooms during pre-planning? And how how are they going to have social distancing in the extended day programs after school? So that's being talked about. Can you discuss, Dr. Balgobin, during pre-planning, will there be any virtual training options for teachers, or do they have to come every day?
I think he's asking you a question.
Oh, okay. I thought you were
I
going.
mean, and if you
were
don't
going down a list.
if you don't have the answer, that's fine.
So I can share with you a little bit regarding EDEP, Mr. Persis. They are to follow the same exact guidelines that we have for our schools. They're part of our reopening plan and the safety component of it. So they are going through trainings as well. As a matter of fact, I can tell you that Ms. Kaur has had quite a few meetings with Ms. Suba, who is responsible for that department. So the same guidelines that we have for our students, they will be adhering to it. The reason and why our teachers, if they have students that they're completing that form, it's not only the safety of the students, but also from a liability standpoint for our district. So that is the rationale for those forms. And I've worked in other districts as well, which we did it the same exact way. It's to really protect the district from any possible liability that could ensue. And in regard to the virtual trainings, there are a few, Mr. Persis, that will be virtual. Teachers that receive their pre-planning for this first week, but there's quite a few, I believe 7 or 8 that we have outlined so far that will be virtual. Now, whether the teachers could stay home and participate in those virtual trainings, the answer to date is no. They are to report to their school site, but they can engage in those virtual trainings from their school site.
Okay. Next one, the lack of internet in rural areas. Any progress?
Yes, sir. I actually will have Mr. Griffin, he can chime in if needed, but one of the things that we've asked Mr. Griffin to do, and he actually went out with his team, and he troubleshooted some of those areas already. So Mr. Griffin, you're there if you would like to add anything. I know you went out with hotspots in some of those areas and troubleshoot, and do you have any update, like most recent update for us?
Yes, we are working a couple of things. Thank you, Mrs. Balgobin. A couple of things. So we're working with the Verizon and T-Mobile because those are the hotspots we do have, and seeing about possibilities, providing them with some addresses to see if they can possibly do a mobile tower. There is no promises there, but we are in discussions with them to see if that is possible. And we do have T-Mobile and Verizon hotspots. And what Dr. Balgobin is referring to is I had my engineers several weeks back during the ICP and during the summer drive around with both hotspots to see where the signal is best and where it's not. And what we did come to a conclusion of is Verizon does work in a lot of these areas where some of the other providers do not. And we're going to have to treat all of these student requests that need these devices, these hotspots, on a case by case, because really where their physical sitting or their address or their home is really depends on if it will work or if it won't, and what provider will and what provider won't. So what we can do, and the promise I can make the board, is we will treat all of these cases on a case by case basis if it takes us going to those residents to make sure and test what provider will work the best, and knowing that we are still working with those providers to see what availability with any they can do some of these mobile towers like they do at the NASCAR races and some of the other sporting events.
Clint, thanks. Can you give me some kind of idea? We're talking about 100 students, 1,000 students. Any ballpark estimate on how many students we're talking about that live in these rural areas without internet?
Yes, so it really depends on how the numbers match up. I really feel a lot of these students, by looking at the numbers of technology requests that don't have internet, they have chosen brick and mortar because they know their their limitations of internet, right? I think they believe, a lot of the parents, that no hotspots are going to work. There's no options. So I do think, with our numbers of looking at them and the technology for internet requests that we have from the survey, it isn't as bad as I think we think. I think those students have chosen to go to brick and mortar, or the parents have, for those reasons. We are going to have some situations to where those parents still are choosing to do remote, and we're going to, again, kid glove that and case by case it, and really try to do what's right by the parents and the students as best in our power. But I do think this is a little bit different than the ICP, where we had all students at home trying to learn remote.
Right.
And a lot of these students, for those reasons and others, have chosen that they're going to go to brick and mortar. And we're over 60% brick and mortar is the numbers that we're looking at right now. I think it's right at 62%. So I really think we're going to land over that 60 percentile, which is really, I think, on the higher end of districts in the state that I've seen, from survey results that are choosing the brick and mortar, which really kind of goes in line with the big need of having that option available.
Thank you, Clint. Can I just keep you here for a minute? Clint, can you address the question I received about, is there a certain type of computer that students will need to have in order to participate in Volusia Live? The question goes on, is there a certain size, speed, memory, operating system, any other special requirements that a student would need to have on a device at their home?
Absolutely. And this morning we actually created a document. Volusia Live or Volusia Online already has their document. And with the chair and the board's approval, I can actually share that right now to get that information out there, but it will be populated today on the website.
Yeah, Madam Chair, I defer to you.
Go ahead. Yes.
Okay.
That's fine.
I will share that, and give me 1 second. Is that popping up?
Yep.
Yes.
Oh, that's excellent. Yeah, that's great.
Give a minute to the public to maybe take a snapshot, or if they want to see that.
Mr. Griffin,
Thank
can you
you.
please load it again, please?
Okay.
So Clint, while you're doing that, the question was, does it have to be a PC, or can it be any kind of an iMac or anything? Does it matter?
There it is again. So we'll go through these. So to answer your question, Mr. Persis, I think the explanation will probably cover that. So both a Mac and a Windows device. So the Mac would have to be an iOS 13 version, iOS and above. In the Windows, we recommend 8.1 and above. And the hardware requirements, 1.8 gigahertz for the processor or better, 128 gigabyte hard drive or better, 4 gigabyte RAM memory or better. And the operating systems, of course, is what we covered earlier, and this kind of goes into detail of the supported browsers and talks a little bit about the Office being a free download from the portal with the student login. So this is very close. Actually, our spec that we're going to get for the secondary devices is actually better than this, but this is a minimum recommendation, so the parents do not have to go out and spend above their means if necessary.
Thank you. Thank you, Clint. Madam Chair.
I also want to share the Volusia Online because I have that readily available.
Okay.
This is Dr. Peterson's version of what she already has kind of posted and sharing. It's a little bit different because their requirements are a little bit different in the type of program they offer. And this is the Volusia Online Learning Minimum Recommendation.
Okay. And once those go live, Mr. Griffin, can you email them to us, please?
Yes, ma'am.
Good idea. Good idea. I can't imagine why you asked that. Oh gosh. Thank you, Madam Chair. Thank you, Clint. I can see that you're on it, and really appreciate the great job everyone's doing. Dr. Balgaman, your whole staff, you're just killing it. I tell you, every time I have a question, you already thought of it. You already have the answer, and if you hadn't, you get back to us right away. I appreciate everything Mark is doing too over here. It's just a tremendous rollout. You know, just think of today, how everything changed just today, and then there's more to come and more to come. But I just marvel at the way we're doing everything. And I guess my concern now is it's almost time, if not already, perhaps to shift a little bit and start really planning on how we respond when COVID is present in our schools and in our classrooms, because it is going to happen. And so, you know, let's, as I say, once the state comes out with their protocols, I'm sure you'll get with your staff and go through each of those and kind of do a walkthrough, if you will. Let's say it happened at school ABC. What do we, you know, how do we do this? And then I'm sure you'll share that with your principals, because they need to feel confident, because every school is going to look to their principal, say, and the parents will say, now what? You know, how does this affect me or my child? You know, that's what I'm saying. I'm given that expectation when people say to me, you know, the $64,000 question, is it safe for me to return to school? Is it safe for my child to return to school? And of course, you know, I say we're going to make our schools as safe as they possibly can be. However, if you're asking me, can you guarantee there will not be a COVID case at my child's school? The answer is no.
Get out of the question.
I mean, absolutely not. And so let's not kid ourselves or give any false expectation that it isn't going to happen. It is going to happen, but when it does, we have a plan, and we're going to deal with it, and we're going to keep it as contained and as small spread as possible. I think that's all the public at this point can really expect and ask for. But thank you. Thank you, Madam Chair.
No problem. Can I ask you a question, Mr. Persis? When you were a principal, did you allow your teachers to bring their children on campus?
Madam Chair, I'm so glad you asked that question. I did in the old days, you know, in the 80s, 90s. I would say it's been kind of a past practice and it varies from school to school depending on what the previous principals did. But it got to the point right near the end of my career that you really had teachers complaining about other teachers whose kids were on campus, and the teacher would be at a meeting. The children may be in the classroom alone, not good, or even worse, the children leave the classroom and walk around on the playground to play without anyone watching them, not good. Bad things can happen. Bad things can happen when children are not supervised. So even though it sounds good, like we're helping the children, helping the teachers, which I'm sure we are, however, there is the other side of it. So I really think it is a best practice to not have children there, just like any other business wouldn't probably allow children to come to the workplace. School is a workplace. And in pre-planning, it is clearly an adult workplace. It's not a child place. And even though that's hard to accept, I know that creates a burden on the teachers. But if you ask me as a principal right now, what I would do, I would have let the teachers know ahead of time, just know this year during pre-planning, you're not going to be able to have your children here. And I hope that was the case, and the teachers didn't just hear about this the day before, because that doesn't give them enough time to make plans for their children. It isn't to be mean, but it's the professional way to do it.
Okay. Thank you. Ms. Cuthbert?
Would you ask me as a teacher if I had my children or grandchildren on campus?
Sure, go ahead, Mrs. Cuthbert.
They did. I can tell you they christened the brand new lockers at New Smyrna Beach High School very well by hiding in them and christening and enjoying it very much, so that when they finally attended New Smyrna High, they were not afraid of that campus. They knew it, they loved it, and they felt it was their school. And it was always nice for them to understand where their mom or dad or brother or sister worked. But then I didn't do it every day. I did it for a purpose. I would bring them on, and this is the day that I didn't have meetings that I would set my room up. This is when, all the cleaning was done, the books, and I always had lots of novels that I had to put back in cabinets. And so they did all of that, and they did, I have pictures of, of a process line, production line, putting stuff back, but it has to be done in a responsible way. And I think a lot of teachers do that. And it's a shame that those who use their kids as hefty people to get things done, but you can't bring babies. And I mean, it would be lovely, but if it was an afternoon and the teacher is in the classroom working, that would be a different story. But anyway, that was, you asked the administrator, you had to ask a teacher in the classroom. But I always did. And it was never disproved at my school, even though it was a high school. It was never disproved.
Well, the reason, and I was going to ask you, I asked a couple teachers, and I've got mixed responses. Some teachers, and one being my sister, every school she's worked at, that just did not take place. I had other group of teachers, like you, would come maybe a day at the beginning to bring all the materials and help set up a room. But all of them agree it was never for the entire week.
Never in the entire.
But her school, she said, and I'm gonna pick on Mr. Long. She said, no, Mr. Long didn't play that. No, you were not bringing no children to school. So, okay. But thank you.
And in addition, Mr. Colon was able to ask a question that really struck me when he was talking to Mrs. Boswell. And that was when you asked her about the spread. Is it substantial or moderate? And she said substantial. And as much as our district has done everything to mitigate, has done everything to plan, put procedures and policies in place to address every issue, there's so much out there that we can't control. We can't control the norm of public's behavioral patterns. There are people out there who are not wearing masks. I'm sure some administrators are noticing either themselves or faculty members or workers, even construction workers, may not be wearing masks. But if they're working by themselves, I'm sure they feel that they can, practicing social distancing. But there's so much we can't control. We have ABM, who we employ to help keep our schools clean. We can't control all of them. We depend on them to do their job, and we're not supposed to. We hired them before I got on the board, but they were hired so that job was done, so the district didn't have to worry about it. And it ballooned into something that I don't think the district ever thought would happen. But we did provide an emergency policy for masks. We are mandating masks. We have 3 options for education. We've purchased PPE from not only the CARES Act, but from our own general fund. Thus, I guess it complicates our ability to pay our raises, which has to come out of general funds. We've made tech purchases. Facilities have been disinfected or promised to be disinfected. We've made surveys and have registrations for students. But there's unclear compliance regulations, and I tried to probe that with Ms. Boswell, but she too, she's under strict orders not to say so too much. We do have a lack of direction from our Department of Education and from our state leader, from our national leadership. I have not heard anything from Volusia County Council. We also have 16 municipalities, several who have said to me, boy, I'm glad I'm not in your shoes. So a lot of people have passed the buck, and it has fallen on schools to prove that the economy is just okay. Some of the data that we've had has been disputed. It might be unclear. Data is only as accurate as those who put the data into the computer. I'm concerned about the conflicts between our union and our school district in trying to get MOUs in place. Our adult employees have a right to be healthy. There is a question of how all of this will play out. And I think it's the fear of the unknown. And I'm so grateful that we have agreed to delay our reopening until August 31st, because hopefully it will educate a lot of us to follow the new protocols, to participate in the training that Mr. Aiken has set forward, as well as our medical personnel with Mrs. Fisher. So I thank you for all of that, because we know that this is a year that our collaborative projects and our collaborative teaching might go by the wayside. We do know that kids will not follow a lot of our CDC guidelines because teens and young kids love not to follow the rules, and they test adult authority. The latest evidence of 10 or more kids can spread the virus like adults do, and that schools are filled with adults. So I think all of us in our district are very concerned about that elephant in the room. We're all very concerned as we get closer and closer to open. The concern of the lack of funding, that Congress has not passed the HEROES Act, because we desperately need support in our schools, and not just funding support, but also support for our social economic learning. And teachers are not medical experts. Our schools are not hospitals. Even hospitals have outbreaks. Even medical personnel have gotten COVID. Our special students and our SEL students are at high risk, but worse is, are they at risk for being at home, or is it worse for them being ill? The economy is dependent on our return to school, really. When our bars are closed, a lot of our restaurants are at 50%. I think we're all in this together. We are a partner with everyone, but we have to realize we cannot be compared to the closing of bars and the restaurants in the same conversation, because we're dealing with children, their families, and our employees. We touch the entire community. These are not normal times. And how can schools be normal when the normal solutions are unsafe? And our students and teachers are I think the largest fear and what keeps me up at night is we have millions of people in this country who are an untapped population who are going to be exposed to this disease. And so what do we do about it? We need guidance, and I'm very proud of the FADS, which is the Florida Superintendents Association, who wrote a letter to our governor Friday looking for additional guidance and support in this matter, because the virus does not discriminate. It does not discriminate for age, does not discriminate race, or economic or social, mental, physical, whether you're educated or uneducated, whether you live in an urban or rural, where you have a hotspot or a full internet connection, whether you're married, single, a parent, or not a parent, whether you're healthy, privileged, or anything else. Because this is something that is unseen and it threatens us all. If it threatens us all, then let's find a solution together. Because, just like in the movie Pollyanna, when Haley Mills first got her notoriety, she carried a quote on a necklace around her neck, and it was by Abraham Lincoln, and it says, if you look for the bad in people, you will surely find it. Let's look for the good in people, because I bet you we can find that and be successful too. So I am encouraging everyone to pull together and fight this disease together. Let's follow our mask policy. Let's follow our mitigation policy. Let's work together with the Department of Health. And for those who are not helping us, let's contact them and say, shame on you. So thank you, Madam Chair.
Thank you, Ms. Cuthbert. Ms. Haynes?
I'd like to first welcome back all of our teaching staff that returned today to their campuses or to the locations where they are training. I am excited and happy that all of you are back and we're ready to start a new school year. I too am thankful that the district as well as the board decided to push off till the very last possible starting day of Monday, August 31st. I think it was the smartest thing we could do, and it gives us an opportunity to watch and see what's happening in other districts that have already started back with training and have students getting ready to return. There is a group out there, though, that, I've made a point this summer to talk about the groups that have been out there working nonstop and to say, thank you to them. And of course, School Week Cafe has been out on the front lines even since we let out this past spring for spring break, and they've continued to provide meals for our kids. They've been out there, giving them out. Our bus drivers and bus assistants also supported and assisted with that. I've talked about the district staff that worked hard to put together an ICP in the spring. And what a lot of people forget is our district staff, most of them are 12 months. They've been working. They've been back in offices and buildings since June 1st, continuing to put together what needed to be put together to answer questions and get documents and training videos and things out to everyone. And they've been coming to work all that time. But one group that I realized the other day that I really had neglected to say thank you to is our school-based administrators. Our school-based administrators, while everyone was at home during half of the month of March, April, and May, our school-based administrators still reported to their campuses. They have not stopped reporting to their campuses. They were there to be able to answer questions, to allow people to come in and out if there were projects going on, vendors to deliver things, just to get the daily mail even. And unless they've taken a day or two off, they have been there the entire time. And they were all there this morning to welcome their teachers and staff back on campuses. And I apologize to them that I hadn't recognized them before, but they are also some of our unsung heroes. because they've been working hard to get everything ready on those campuses. I know some of them early on looked into switching out furniture on their campuses. Some of them have gone in and set up the furniture in their classrooms, you know, to show the physical distance and make sure. I've even seen pictures of them out delivering the PPE kits to the rooms so that they were already ready and their teachers wouldn't have to be responsible for that. So I want to thank all of the administrators out there, all of our administrative teams on our campuses for all the hard work that you've done. I'd like to close today, and I'd like to ask everyone to do something positive and to show a way of kindness. On any given moment, social media can be our friend or it's our enemy. There's been a lot of negativity on social media, and it only seems to have gotten larger, especially over the last few days as we've headed into teachers and staff returning. So what I'd like to ask today is, sometime this week, if everyone that uses social media, whether you use Twitter, Instagram, Snapchat, Facebook, I'd like to encourage you to capture a picture or a moment where someone showed you kindness, where you showed kindness, or a positive moment of something happening on one of the campuses. I know that I probably the last week or so should have taken my phone and snapped a picture or two, watching people working together, watching, you know, staff helping new teachers get settled in and things like that. But I'd like to encourage everyone out there to capture something positive or somewhere where someone is showing kindness, and I'd ask that you post that. I'd like to see some positive posts on those forms of social media and hear about the great things that are happening out there, because there are a lot of great things. Even if you just snap a picture of your administrator and say, here's something that my administrator did that made my life easier as I returned to campus. And parents, you know, you too, as we get ready to open, I'd encourage you and your students to also capture some acts of kindness or positiveness. And I really would love to check into maybe my social media Thursday night and see those wonderful things that are going on out there. But I do look forward to visiting my campuses. I've already been at several of them and welcomed some new staff, and I'm looking forward to visiting and welcoming everybody back along with the new staff. So Dr. Balgobin, also a big thank you to you and your teams, because you've been working around the clock 24/7, weekends and everything else. And thanks for always being responsive when we reach out and ask you questions or ask for assistance. We do appreciate what you and everyone here are doing. Thank you.
Yes. Dr. Balgobin, anything you would like to add?
Thank you, Madam Chair. I think the board really, what the board has said today in terms of our appreciation to our administrators, they have really worked very hard over the, you know, when everyone was on break, they never, if they took a couple days here and there, but they were always on duty doing what needed to be done. So I'm very appreciative. I did check in on each division last week as they were part of their workshops. And such positive attitude. They're ready. They were ready to welcome their teachers back. They're looking forward to making it, despite all the obstacles and barriers that are in our way, to make it a great year. And I think the board said it best in one of our presentations that we were having for our strategic plan. Let's examine our strengths. And I think the board said our people, right, are our strengths. So I say that we continue to do our strength. We will persevere through this. We will show how strong we are as a team. And no wonder that together we are stronger. That is our theme for the year. So thank you, board members, again, for all that you do behind the scene. And I look forward for us continuing to work together to make this reopening as smooth as possible. And welcome back to our amazing teachers. Our cabinet members will be visiting schools this week. So I will have a report for you next week on how those visits went. Thank you again.
Dr. Balgobin, we do not have a meeting next week.
So,
Madam Chair, I'd like to make a motion.
Madam Chair, respectfully, it's been every week, so I just assumed.
No,
Thank you
next,
for the good news, though.
you're very welcome. Well, the next Tuesday, we need to be encouraging everyone to go out and vote. Next week is our primary, so we normally will not have a school board meeting on that primary, that Tuesday. We normally will meet that Wednesday, but our next meeting is actually for the 25th. I too just want to tell all faculty, staff, everyone that is their first day on campus, welcome back. Things have changed. We're in a different world, but we have to embrace change, prepare for it. I think what we're seeing, I've said this many times, will become the way education will be delivered. Parents are going to demand that education be delivered in different modalities. We normally would see that at higher education. I knew eventually we would see it in K-12. I didn't know it would be so soon, but it is upon us. And rather than us trying to, say we want to go back, there's no going back, is where do we go from here? And that is what our plan is. We need to plan to where do we go next? And again, how will we look 10 years from today? I have one question, and I know Mr. Persis did ask the question. I didn't hear a response, and maybe you didn't have it, in reference to our extended day program that we're going to start next week for teachers. What was your question, Mr. Persis? Was it how we're going to handle social distancing? Okay. So I wasn't sure if you had a response, but if not, you can always email us. And I think my question, which came up about teachers bringing their children to school this week, why did we not open extended day for this week?
So when they looked at the date for our starting extended day, it was before we did the delayed start
Okay.
for the year. So actually, Miss Patty Core has had some conversations. We were trying to see if we could start it this week, but it was just too short of a notice to gather all the staff members and get it ready. But I will tell you that for extended day, we will be adhering to the same guidelines that we have for our school students when they're doing regular hours. So they will be adhering to the same guidelines. The staff for extended day will be trained on those safety measures. Every measure that we have in place from a safety standpoint for our staff, our EDEP staff will also be trained. And did I answer your two questions?
Yes, you did. Okay. All righty. If nothing else, colleagues, we will adjourn our meeting. We will see you on the 25th. Thank you.